Good day. It's right at the middle of morning and afternoon, so good midday, and welcome to our first event in Hopkins Nutrition 2018, the first event of a celebration that we'll be talking about throughout the day that commemorates the publication of Elmer McCollum's first textbook on the newer knowledge of nutrition. We'll talk much more about that later on. But throughout the day, we have our 10th George G. Graham lecture to start off. And then we'll have a symposium in the afternoon with all of our speakers are just dynamite. They are experts and are at the leading edge of their field in nutrition. At the end of the day, we have a special DSM Sight and Life lecture in Somer Hall to accommodate a large crowd from Peter Menzel and Faith DeLuzio about a very special presentation on our hungry planet, what the world eats, and then a reception later on. So to start things off, we have our 10th George Graham Lectureship by Kelly Brownell, who is the director of the World Food Policy Center, who will be introduced in a few minutes by our dean. And just a few words, though, about this lectureship. George Graham was the founding director of the Division of Human Nutrition in the Department of International Health in the late 60s, early 70s, through the early 80s, before he semi-retired, and the division leadership was taken on then by Ken Brown, and then Benjamin Caballero, and Laura Caulfield, and more recently myself. George was a pediatrician, a nutritionist. He established the Institute of Nutrition in Lima, Peru, in the late 60s, early 70s, which is one of the leading nutrition institutes now in South America, a tremendous research institute, clinical facility, and so forth. He was a prominent pediatrician. He was enslaved to data. He listened to data, he spoke to the data, he talked about the data, interpreted, and didn't let anyone's opinion get in the way of his interpretations of the data. He was quite a prominent figure in early nutrition pediatric nutrition. These are just some of his papers and some of the topics that he was dealing with in his career, everything from copper deficiency to infantile malnutrition and recovery through various infant formulations, dealing with lactose intolerance, working a great deal with Dr. David Page, who is here on our faculty, maybe here today. There were many papers, especially related to child growth and defining the kinds of diets that children would best grow by, looking at digestibility, utilization of protein from different kinds of foods. And so his breadth of expertise was wide and appreciated, and he was a tremendous mentor. We have a George G. Graham lectureship, George G. Graham professorship that was launched in 2005, and I'm honored to be that inaugural professor in his name, at which time his family was here. Since then, since beginning in 2006, we've had a Graham lectureship. We've had wonderful speakers. Ken Brown launched the lectureship in 2006, talking about food fortification. Bill McLean, who was faculty here for a number of years, talked about small-scale studies and what you can learn from small-scale studies in Peru. We had Nevin Scrimshaw and Carl Taylor with Charles Stevenson, Claudio Lanata, and our own Bob Black deal with nutrition infection, celebrating the 40th anniversary of the WHO monograph on nutrition and infection. Now we are celebrating the 50th anniversary of that. But it was a wonderful session and a conversation that Nevin and Carl, now both deceased, gave a tremendous performance in terms of how they came up with the ideas of the interactions that we now study so carefully between nutrition and infection. We've had Ricardo Awawi, Andrew Prentice, Michael Golden, Bruce Ames, Lambert Loomy, and Dick Hall, who will be with us a little bit later on today. Bert and Dick conveyed to us a lecture about the airlift that broke the Dutch winter hunger of 1945. And Dick Hall was a navigator on those first sorties that flew food into Rotterdam, and then there's been an epidemiological study since that Bert Loomy has done. And then our last lecture was in 2016 by our own Ben Caballero, who talked about the Cuban optic neuritis epidemic and the different forms of malnutrition that has beset Cuba over the past 25 years in the studies that he was doing. So we've had wonderful lecturers, and today is no exception. And so without further ado, I would like to invite our Dean, Ellen McKenzie, to come up, offer a few words, and to introduce our speaker. Thank you.
Well, thank you very much, Keith, and good afternoon to everybody. This is a wonderful event. We are here to celebrate 100 years of nutritional research, and it was a great 100 years. Keith, you and your colleagues have put together a tremendous program, starting with our guest lecturer here today. And later on this afternoon, you're going to be hearing from Karen Thomas, who's our school's historian. And she'll talk us through the legacy of the many leaders that have contributed to these past 100 years. But among these are E.V. McCollum, who I think most of you in this audience know. You'll learn more about him in a little while. But he was a true hero of public health by demonstrating the close relationship between nutritional deficiencies and symptoms of disease. But I could not help but think of E.V. McCollum yesterday when we unveiled the school's strategic plan for the next several years. In this plan, we've committed to unleashing the power of public health through the power of teaching, power of science, power of partnerships, the power of people, and very importantly, the power of communication and advocacy. And when you look back at McCollum's work, he was one of the first real true advocates in public health. If you look at the work he did contributing to McCall's magazine and writing up a cookbook. Actually, we had a meeting late, I guess last week, late in the afternoon, and I was bemoaning the fact that I just didn't know what I was going to cook for dinner that night. So he flipped out McCollum's cookbook, and the cookbook, it's every day of the year, so it was October 8th, and he said, well, this is what you should cook, and he solved my problem for the evening, so that was very helpful. But McCollum really contributed to all of those 5 pillars of the school, but I think in particular, I think about the work he's done in advocacy, and it's the kind of advocacy that we need to continue to do here at the school. Fast forward to today, you look at the problems of malnutrition, and they've really they've become a little bit more complex, if you will. I think everybody would agree that 100 years ago, we could not have imagined the problem that we currently have with overnutrition or obesity that we're facing today. And while we cannot underestimate the unfinished agenda of the undernutrition problem in many parts of the world, and in some parts of the world, a dual burden of under and overnutrition, if you will. I think it's interesting that the turn of events, and we're really looking at this problem of obesity today. And I cannot think of anyone who has contributed more to the dialogue around this newest challenge we have in nutrition than our speaker today, who is Kelly Brownell. We are thrilled to have Kelly give the 100th George Graham Lecture. The school is truly honored to be able to host this lecture every year, given the generous contributions of the people that Keith had mentioned earlier. A few words. Kelly is well known to a lot of us in this room, but just a few words. Dr. Kelly Brownell is currently the director of the World Food Policy Center at Duke University, where he's also the Robert Flowers Professor of Public Policy and a professor of psychology and neuroscience. And between the years of 2013 and 2018, he was also dean of the Sanford School of Public Policy at Duke. In 2006, Time magazine listed Kelly among the world's 100 most influential people in its special issue that featured those individuals whose power, talent, or moral example is transforming the world. Pretty heavy. He was cited by the magazine as a leading warrior in the area of nutrition and public policy. In addition to these accolades by Time magazine, Kelly has also published quite in a prolific way to the scientific literature, publishing over 350 articles, some 15 different books. He has served as a president of several national organizations, including the Society of Behavioral Medicine, the Association for the Advancement of Behavior Therapy, and the Division of Health Psychology of the American Psychological Association. Dr. Brownell has advised the White House, members of Congress, governors, World Health Organizations, and media leaders on the issues of nutrition, obesity, and public policy. He was cited as a moral entrepreneur with special influence on public discourse in the history of the obesity field. Kelly was elected to membership of the National Academy of Medicine in 2006 and has received many, many awards, which are way too numerous to mention here. Here at the Bloomberg School, we are fortunate to count Kelly as a friend and a colleague and a partner. As part of the Bloomberg American Health Initiative, Kelly has been central to our thinking about the obesity epidemic and how it relates to the country's food systems, one of the 5 signature areas, if you will, of the American Health Initiative. He is co-author on the document from the initiative that frames the core issue around obesity in the food system and has been involved in helping us establish our priorities in this particular area. For his many contributions to the field and to his ongoing work with us and the American Health Initiative, we thank him, and we're thrilled to have you be our 10th George Graham Lecturer.
Well, thank you to, we're going to get the slides up? Okay. Great, thanks. Thank you for the wonderful introduction, Dean McKenzie. I appreciate that. And Keith, thank you so much for the invitation to be the Graham Lecturer. I couldn't tell you how humbled I am by this. One, because I have so much respect for Johns Hopkins, but then also the tradition of this particular lecture is very impressive. And when I see the people that you've had here before, and I looked it up on the web, I was very, very impressed indeed. So it's really nice to be here. A good friend of mine, one of your faculty members who recently retired, Steve Terrett, came when I was at Yale University, where I was many years before moving to Duke. Steve would come and lecture in my classes, and he would introduce himself as Stephen Terrett from the oldest, largest, and best school of public health in the world. And then he would mention that 3 or 4 times during the lecture. He'd say, by the way, did you know I'm from the oldest, the largest, and the best school of public health in the world? So just like a duckling imprints, I was imprinted with that. And so I had a strong belief in how important Hopkins is in the world of public health. But in nutrition in particular, the work has been very impressive. Over the years, and I've known people from Hopkins for decades now, I've really very much valued the relationships and have established lifelong friendships and connections that are very important to me. So it's an honor to be here. Thank you very much for inviting me. So when I was invited to do this, poor Keith went back and forth with me about what I was going to talk about. And there were two things I was going to talk about. And the one that I was thinking of but will not talk about today is the World Food Policy Center that we've created at Duke University. And I decided not to do this, but to take a little bit of a higher risk enterprise in what I'm going to discuss today, but also because the work of the World Food Policy Center will be quite familiar to the people at Hopkins, especially those who work in the Center for a Livable Future, that has a very similar mission to what we're doing. But just to describe very briefly what we're up to, we're all about trying to bridge different areas of food policy based on the hypothesis that disconnection between these areas is leading to gaps in food policy, conflicts between areas, problems with funding, and the inability to form a strong coalition, as you might, of groups that could advocate for important policy change. So in bridging these areas, it's a very daunting enterprise because it's hard to be good in any one of these things, much less four of them, but it's an extremely interesting enterprise. And as I describe this to people, if I could plot the learning that I've had over my career, it would look like this, but now it's like this, because we're doing all these different areas, and it's very exciting to us. And part of what we're doing global work, but we're also going to be working with the city of Durham as an urban area and a rural North Carolina county to see if we can create model food communities. And so the hope is to take these two places, try to get everything right, develop a set of best practices around particular areas such as early child development and nutrition. And we're very excited about that. And we discussed possible collaboration with people at Hopkins because of all the wonderful experience in Baltimore and other places around the world about what can be done in cities. And so we're looking forward to nurturing those connections. But that's not what I decided to talk about today. And this is what I decided to talk about today. How good are we really at creating change? And how can we maximally harness the power of science in order to create social and policy change? And to us, it's a very interesting topic, but presents lots of challenges too. So what I'm going to talk to you about today is a model where we attempt to better harness science to create social and policy change. And then I'll give you a number of case examples. Now, before I launch into this discussion, I have to say that if there's any place in the country that one could use as a model for doing this, it would be the Johns Hopkins School of Public Health. And in fact, if I were to be giving this lecture somewhere else, I would have a series of about 5 slides that would describe the work of Al Sommer and how that work has harnessed science in order to create tremendous change on the world level. So these concepts may be familiar to you, but let me give you some examples of how we've applied these. So we're hoping, I'm assuming most of us in our careers, to create impact from knowledge. We're generating knowledge, we're dispensing knowledge through our teaching, we're learning if we're students, but we hope to do something with that knowledge will create impact. And so we're hoping that society somehow gets served from the knowledge we create, but have we thought much about how this transfer occurs? And can we think about this in a more systematic way? And these are some of the questions that we've asked. So the question is, what lies in the middle there? And can we think about this in some systematic way? Can we train people to do it? Can we reinforce people in academic settings for doing it in ways that generate more impact from the work we do? So the frustration that I had in my own career that led to this came from the fact that there was a lot of science, but there was fairly little uptake from it out there into the real world. And when there was intake, there tended to be a very long gap of a number of years before the uptake occurred. And so what was happening, at least in my orbit, is that research was reaching relatively small audiences. I mean, when you come down to it, most researchers do work, and there's a very small group of people who read that work. I mean, it's a small group of colleagues or students around the world. I mean, in some cases, it could be 10 people or less. But though that group of people reinforces each other. We invite each other to meetings, we review each other's papers, and so within that orbit, you feel like you're making a difference, and you are. But is it making a difference out there beyond that orbit is the real question. And that research often misses key audiences. I'll describe more about that in a minute. And this is all because of the poor links that exist between scholarship and policy. Now, part of this is how we construe the concept of impact. So if we're reviewing people for promotion, for example, and we're looking at impact, it tends to be things like this. It could be the amount of grant dollars one generates or how many publications, but more and more impact is specified by these sort of indices. Well, what are these indices all about? They're all driven by how much other scientists cite our work. Now, the outside world would look in on this definition of impact as being pretty silly, that it doesn't matter whether you're having an impact on anything out there in the world. All that matters is other people who like you in the field are citing your work. Well, it's kind of a strange concept of impact, so one could think about doing it in a different way. Now, usually in science, people are trained to do their science well, and they're trained to communicate it well with other scientists, but not with other parties out there who might be able to take the information and do something with it in order to create change. And the metaphor I use to describe this is of a relay race. So if you're running the relay race, you can only qualify to win if you successfully pass the baton from one party to another. And if somebody drops the baton, you're disqualified. Now, a lot of what we do has this baton-like feeling that we do our work and we hope that somebody takes the baton from us and does something with our work in order to create the social and policy change that we hope for. But if we're not trained to do it, and we don't even know who to pass the baton to, or what information should be contained in that baton to be most helpful to the people who receive it, then we're not being as effective as we might. So these were issues that we've struggled to identify with. Now, in some ways, the field of science is exquisitely good at completing certain tasks, but some other things we're not very good at. And one of the things we're not very good at is being quick. And the policy world moves very quickly. I mean, a lot of you have been involved in this, but policy decisions very often get made in a very short time frame. And the way that we tend to do science can be quite out of sync with this. So let's just say, for the sake of argument, and of course nobody would ever hope for this, but let's say the scientific world were setting out to make itself as least relevant to the world as possible. So what would you do? Well, it would be very, very slow. It would take a long time to get funding to do the work. It would take a long time to do the work. It would take a long time to get permission to do the work if you're using human subjects. Then it would take a long time to write the papers. It would take an even longer time for the review process to take place and for journals to publish it. So in the meantime, the world has gone through 10 different iterations of whatever the issue was we were dealing with, and we're hamstringing ourselves by being so slow. Now, part of that is baked into the way science needs to be done, like with peer review, for example. But it's all not necessarily like that. Like, think how long ago it would have been possible to have journal articles published online the week they were accepted for publication. But we went decades with old-fashioned paper copies of journals that would come out months after the paper had been accepted for publication. We let that happen, and we didn't need to, but we did. We would also communicate it poorly. We would communicate well with each other, but not with the outside world. We would be unresponsive to real-world questions and only address questions that other scientists felt were important. It would be programmatic only, and I'll come back to this with the concept of strategic research. There would be conflicts of interest that would undermine the credibility of the field, and certainly that's happened in the nutrition field. And we would create indecipherable jargon that would make it hard to connect with other people. My original training is in psychology, and so somewhere along the line, psychology came up with the word symptomatology to describe symptoms. Well, why don't we just say symptoms? You know, we talk about methodology a lot. Well, we could just talk about methods. They're just one example after another of things that we do that can get in the way. So, in fact, we do all these things very well, and they're good for some outcomes, but not for others. So the issue that we tried to address, is to find a way to link scholarship to public policy and address this as a fundamental area in the field. So our beginning place with this is that research can have impacts on a number of different audiences potentially, and here are some, and that it seems to me we're quite good at communicating with other scientists, but not necessarily with agents who can create social or policy change. So the issue is, how do you create impact from the work? And again, what's in the middle that can lead to the social and policy change? So we created a concept that we refer to as strategic science, and here's how it works. One is that we first ask ourselves, who are the change agents who are in a position to do something about a problem? And then how can we work with them in order to create the social and policy change? Now, it seems a pretty straightforward thing to do, but how often do we do that, actually? And do we train our students to do that? So in the area of obesity prevention, I'll give you some examples from that. There are a number of, I'm sorry, didn't mean to do that. There are a number of change agents, some of which are pretty evident. So legislators are who we think about as the default for changing things, but of course people in regulatory agencies can have big impact. The courts and the legal issues can be tackled in very interesting ways. I'll give you one example of that. The press can be a very powerful change agent if public opinion is what you're attempting to change. And there are NGOs that are very powerful, and in the case of nutrition, the industry can be an important change agent. So this is just a partial list, but it gives you a sense of things. Now, one can imagine doing much different research depending on which of these change agents might be able to take advantage of the information. So if you're preparing information that could be used in the courts, it might be much different than if you're providing information that legislators could use or regulators could use. So we ask ourselves, in the case of a particular outcome, who can do something about that outcome? How can we interact with them in a way that informs our research, and then how can we translate that into information that will be valuable? So the question is, can we produce this virtuous cycle? So as I said, it begins with identifying the change agents. Now, the change agents could be a school board. It could be the press. It could be a state attorney general. It could be a lot of different players depending on the problem. And since all of you are not working in my area, you'll have your own set of potential change agents. But whoever they are, can we interact with them in ways that inform our research? So we develop strategic questions based on their information gaps, not our information gaps. And then, can we conduct the research and then develop a communications stream that feeds that information back to the change agents? And hopefully this provides a cycle that keeps the information flow going. Now, when we talk about creating impact from science, we generally are throwing our work at the change agents. We issue press releases, we write policy briefs, we throw things out there in hopes that somebody will take the baton and do things with it. And that sometimes works. It's definitely worth doing. But it ignores the causal arrow going in the reverse direction. And so what we think about is this two-way flow of information. And to use the bridge example again, is can we create this bridge that doesn't go just one way? So can we be informed by the change agents and produce information that will be helpful to them? Now, this concept of strategic science is captured in this brief paper that a colleague of mine and I wrote, Christina Roberto at the University of Pennsylvania. And if you'd like, I'd be happy to send this to you. You could just get in touch with me, or it's available on the web. So I'd like now to give you 4 case studies of the application of this model. So, imagine us struggling with this issue of trying to create more impact, sitting down with our graduate students and our research group and thinking, okay, how do we go about this? And so the 4 case examples that I'll give you are our attempts to do that. So case study number 1 has to do with menu labeling. So menu labeling refers to regulations that require restaurants, particularly chain restaurants, to post calories on restaurant menus. So the first jurisdiction out of the gate on this was New York City. And so when Tom Frieden was the Commissioner of Health there, he and others in the Department of Health pushed very hard to get a menu regulation through. They accomplished this with the Health Board, and the regulation was about to go into effect. They got sued twice by the industry, but successfully prevailed in the courts, and the regulation went into effect. So, of course, what you hope when somebody takes a measure like that and is courageous enough to go first, that lots of other people will go second, third, fourth, et cetera, and you get a public health thing that has some spread and some scalability. So a number of jurisdictions express interest in doing something after New York did. Miami, Philadelphia came out of the gate. Nashville was interested as well, and the state of California. So the beauty of a state, of course, is you capture a lot more people than going city by city. So we were very interested in the process underway in California. The governor at the time, Schwarzenegger, said the only way he would sign legislation was if the public health and restaurant communities could agree on the language of the bill. One morning at about 10 o'clock, somebody from California called me from working with a prominent NGO there and told me what was going on and said that the industry wanted to extract a compromise in this discussion, and that was to exempt drive-in windows from the need to have the calorie information. Now, the restaurant industry claimed that these boards are only so big, so they couldn't cram all that calorie information on it, as if they couldn't afford to build a bit bigger board, but that was the rationale. So when I heard this at 10 o'clock that morning, I was thinking, there seems to me a lot of people drive through those drive-in windows. I didn't know how many, but it seemed like a lot. And you just get this, the image of the modern drive-in window and how people wait a long time in the cars, even though they could probably go in and order much more quickly. So I canceled some noon meetings that day, and I got a clipboard, and I sat across the street from a McDonald's in Connecticut, and I just counted how many people drove in versus walked into the restaurant. So it was not high science, it was just me and my clipboard, and I might have mistaken a dog in the front seat for a person. I might have miscounted it, I might have dozed off, who knows what might have happened. But after my several hours there, it appeared that about 60% of people were driving through rather than walking in. So my grad students then went to work and did a proper study. So they had reliability checks, several meals a day, restaurants all over the place, and thousands of observations by the time they finished, and they published this study on it. And it turned out to be just shy of 60% when they collected the data. Now, this study had very interesting impacts because we did it quickly, we turned the study around, and gave the information right back to the NGO that was working on this, who fed the information to the governor and the others involved in this legislative process. And they decided that it makes no sense to grant this exemption because you're missing 60% of the intended customers. So this little study, which may have taken 2 weeks to do, may have cost $50 for some clipboards, made an enormous difference in policy. Because after California, then place after place where this exemption was being requested, it wasn't granted because of this little study we did. And so this wasn't high science. Nobody in the scientific literature had said it needed to be done. But we did it because we were listening to the change agents and then feeding the information back, and we had that loop going. And so in our case, the impact seemed to be through the NGO. That was in turn affecting legislation, and that was leading to the social and policy change. So that's case study number one. Case study number two has to do with the marketing of foods to children. When I was at Yale, we were lucky enough to receive funding from the Robert Wood Johnson Foundation to study the amount and impact of food marketing directed at children. And this work was led by Jennifer Harris, who continues to do very fine work on this area. This was expensive work, detailed work, because we were buying Nielsen data and a number of things to try to find out the impact here, and published a series of reports. So the first year, we looked at the marketing of breakfast cereals to children, the second year the marketing of fast foods, and the third year the marketing of sugared beverages. And then we looped back and redid those after those first 3 years. And if you're interested in the reports, there are a series of facts reports that one can pull down from the Rudd Center website. The Rudd Center subsequently moved from Yale to the University of Connecticut, where they are now. Now, what the study found was interesting, and you'll probably say, yeah, that's what I would have expected, but it's pretty stark when you see it. So imagine creating a rank-ordered list of all the cereals that might be marketed to children. And you rank them according to a nutrition index. And there's a nutrition index developed by researchers at Oxford University that we use for this purpose. And at the top of that list, you put the cereals with the worst nutrition scores, and it goes from worst to best. So the worst would be the ones with the least fiber, the most sugar, et cetera. And then let's look at how much the best dozen cereals are marketed to children, the ones with the 12 best nutrition ratings for using that index. Through TV advertising, through advergaming, which is an internet phenomenon, and through other youth websites. And of those 12 best rated nutrition cereals, there is, and these happen to be the ones, you see exactly 0 marketing to children. Now, if you take the worst dozen cereals by nutrition scores, and here's what they happen to be, and then let's populate the list with how much marketing is done to children, and you see a pretty striking picture here. So the companies have a range of products. They vary a lot in nutrition quality. Why are they marketing the worst ones to kids? Well, we'll come back and talk about that in just a few minutes. But the fact that they are is really pretty interesting. So we had hoped, we were thinking about who the potential change agents were with this. Now, it wasn't going to be other scientists who might read our journal articles. They would be important because they could do certain things in the picture, but the other scientists wouldn't be in a position to do something about this. It's hard to think about regulating this through legislation because the First Amendment of the Constitution protects many forms of speech, including commercial speech. So it's hard to regulate things like marketing. But you can change things if public opinion changes and the companies feel pressured to do something about this. So we tried to anticipate what the industry defense would be when our results were made public. And we would hope we would get a lot of attention in the press so that the companies would be embarrassed about this marketing practice and the parents would put pressure on them to do something. So you're starting to see the change agents here, the press potentially, and then potentially parents, and then the companies from that. So we knew we were going to put our work out. We were hoping to get a lot of press attention, which turned out to be the case. And we wanted to predict how the companies would defend this practice. And it wasn't too hard to understand this because I've been at meetings with people from the cereal companies and had heard their rationale for doing things like this. But also there was a very interesting paper published by the chief scientific officers at Kellogg and General Mills. They collaborated on this paper, and basically here's what they said, that food doesn't become nutrition until somebody eats it. And then they also said this, that children like the taste of ready-to-eat, that's a euphemism for high sugar, ready-to-eat cereals and are therefore more likely to eat breakfast. So we figured the industry would say 3 things in their defense. One is that eating breakfast is a good thing. Well, that turns out to be true. Second, that cereals can be a good way of delivering nutrients, also true. But third, that children won't eat the cereal and hence get no nutrition from it if it doesn't have a lot of sugar. This is a testable hypothesis. So we set out to test it. So we did a randomized trial, again led by Jennifer Harris, where children were given a breakfast and were randomly assigned to one of 2 conditions. In one condition, the children got a low sugar version of a cereal, like plain cornflakes, and they could pour as much cereal in the bowl, as much milk, they could add sugar, they could add fruit if they wished, and we just let kids see what they would eat ad lib. The other condition, as you can imagine, was the same, except we used a high sugar version of the cereal like Frosted Flakes. And then we simply saw how much children ate. In the condition where children got the low sugar version of a cereal, the children had just about exactly the nutrient profile you'd like to have a child have for breakfast. And the way they sweetened their cereal was to put fruit on it rather than voluntarily put sugar. And so they got the nutrition boost from the fruit. In the condition with a high sugar version of the cereal, the nutrition profile was much worse. So we had directly tested this. Now, we published this in pediatrics, and so, it was peer-reviewed and all that sort of thing, and we communicated it to other scientists. But the real impact on this was in the press when they were contacting the presidents of General Mills and Kellogg and asking them, why are you marketing your worst products to children when you have better products in your portfolio? And they would say, eating breakfast is a good thing. Nutrients can be delivered in cereal, and children won't eat it unless it has a lot of sugar. And they would say, well, Yale just did the study that said that that's not true. Now, why would the companies be marketing the high sugar version of cereals? Because kids don't stop eating it. Somehow satiety is thwarted in this process, and kids will pour twice as much or whatever increased amount in the bowl, and they'll just eat a lot more. So the box is empty earlier, you have to go back to the market more often, and the companies cash in. So that's why, the Trix Rabbit and it's Tony the Tiger and the Fruit Loops bird are all attached to high sugar versions of cereals. So this had a really interesting impact. And sometime after our results got published, General Mills, the largest retailer of sugared cereals, announced they were going to make a 25% reduction in the sugar in their children's cereals. Now, there's no way we can claim credit for this because there have been lots of people working on the topic. But to the extent the work we did had any impact here, it was probably through these particular routes. The press, public opinion, and then the industry made the change. Now, we could publish 1,000 scientific studies on this and never get the company to make a public health move like a 25% reduction in sugar in their cereals. So this was an example of a pretty easily done study. It cost more than $50 and took more than 2 weeks, but it still had an impact on policy. It was a relatively straightforward thing, and it was because we were trying to predict the effects. Case number 3 has to do with consumption of sugar-sweetened beverages, a topic that my colleagues and I have worked on a long time. Some of you may know a well-known researcher at the University of Michigan named Kenneth Warner. Ken was the dean of the School of Public Health at the University of Michigan and a terrific person. And in my early work on the obesity area, I was reading Ken's papers on tobacco, the area that he worked, because I found them very persuasive. And among the things he had done, he's an economist, he had modeled the expected impact of taxes on cigarettes and then had quantified the effect of taxes on tobacco use. And it had pretty profound impact on that. So I began to think, this goes back almost 30 years now, whether taxes might be used in the food area in order to increase consumption of healthy foods and decrease consumptions of foods that contribute to ill health. And so sugared beverages appeared to us to be a good target for this, for a lot of reasons that I can explain later in the Q&A if you wish. But this idea of taxing foods became quite interesting to us. So the first time I wrote about this in a public format was an op-ed in the New York Times in 1994. But then in the late 1990s, and then in later years, interest in this started to build, and things really kind of peaked during the economic crisis in the first decade of this century, when governments were strapped for money, looking for ways to generate revenue, and new taxes were one possible way to do that. And if you're going to do a tax, what better than to do a tax that would generate revenue that might be used for other purposes, preferably health-related purposes. So I wrote at that time with Tom Frieden and a perspective piece on making a public health argument for why sugared beverages should be taxed. And it's pretty self-evident what the arguments would be. There's very high consumption of these beverages. The beverages are clearly contributing to ill health. The science is rock solid, showing that their consumption of these beverages is linked to risks for obesity and diabetes and other problems. And so it would make sense to use taxation to drive down consumption. And we propose particularly a tax of 1 penny per ounce of any beverage with added sugar. So that means a 12-ounce can of a soft drink would be 12 cents more, but a 2-liter bottle would be more than 60 cents more in price using that tax strategy. So we proposed that and then wrote a subsequent article with a number of other people that brought in economic perspectives. So we made both a public health and an economic case, arguing for externalities and information asymmetries that we hope would persuade economists that this would be a good idea. So we would have that group on our side. So these were the sort of conceptual articles that talked about how a tax might be structured and what a rationale for it might be. But we began to think of what the strategic research might be to surround this, what would be most helpful in this context to the people who would be ultimately making the decisions on doing this. Well, one thing that legislators would need to know is how high a tax should be in order to decrease consumption. So the economists working with us, Tanya Andreeva, did some modeling on this and looked at the price elasticity of sugared beverage consumption and figured out what the inflection points would be with higher and higher taxes and what would be a reasonable level of tax that would produce a reasonable level of decreased consumption. And it turned out the penny per ounce that we had recommended seemed to be about right, that it was high enough where you would get a recognizable change and a reliable change, but we thought not too high to dissuade politicians from doing it or consumers to rebel against it. But some of the politicians who we thought might consider this may not be interested in the public health consequences of this, but the revenue generating opportunities. That the fact that you're taxing sugared beverages could be incidental to some politicians who just want to find a way to raise money, either to reduce deficits in government or to fund programs that they believe are important. So the revenue generating potential of this is really important as well. So our colleague Tanya then did a subsequent study estimating the revenue that can be generated from these taxes. Now this became very interesting, but we thought if this is all we do and we publish this paper in a journal and politicians don't have access to it, we're not going to have impact. So we created an interactive website and the website still exists today, where you can go in and put in any major city or state in the US, put in the amount of tax that you're thinking about, and it will generate how much revenue, an estimate of how much revenue can be generated by that tax. And it creates a chart that looks like this. So using Maryland, for example, and these are up-to-date numbers, if you put in a 1 penny per ounce tax on sugared beverages, you would generate $250 million a year in revenue. So that's enough to capture the interest of legislators. You can do something with $250 million. So that captured a group of people who were interested in the revenue rather than the public health impact. And that played out in very interesting ways in the city of Philadelphia. So the previous mayor, Michael Nutter, was very interested in one of these taxes. Now, the way I heard it play out, Don Schwartz, who was the health commissioner of Philadelphia at the time, was meeting with Mayor Nutter, and they were talking about two things: wanting to do something about childhood obesity, but not having any money to do it. And Schwartz then said, well, let me show you something on the computer, and pulled up this revenue calculator. This is what he told me. And the numbers for Philadelphia were really pretty impressive about how much revenue could be generated. So Nutter then went ahead and proposed the tax. And after a huge, long political battle, where the industry spent unbelievable amounts of money fighting the tax in Philadelphia, it didn't work. It didn't quite get through city council. It came close, but wouldn't quite make it, so Nutter withdrew it at the last minute. Now, his successor as mayor comes along, Mayor Kenny, and decides he'll propose the tax again. But instead of proposing the tax for its public health impact and obesity reduction, he will propose it as a means of raising revenue for programs that he thought the citizens of Philadelphia would support, in particular early child care and education. Then the tax passed. So the amount of revenue that could be generated becomes an important part of that discussion because he has specific numbers for Philadelphia. Now, these taxes in the U.S. have passed in a number of places. Now, the bottom, Chicago, Cook County, I've crossed that out because they passed the tax, but not too long ago repealed it. There's also been a setback in California where Governor Brown recently signed legislation that preempted cities from doing a tax on their own. So some of these cities in California, like Berkeley, Oakland, San Francisco, and Albany, may not have taxes after all after this preemptive legislation comes in. And there's a very interesting legal issue going on there that I'll come back to in a few minutes. Outside the U.S., there are taxes in more than 25 countries, including a number of major countries. So there's now a sufficient body of research that we know pretty much what the impact of these taxes is going to be. And there are a lot of natural experiments because different places have used different levels of tax. Mexico put in a tax and it amounted to about 10% increase in price. This is about half of what you might get from the penny per ounce that we had suggested. And we were very worried that that would be too low to create any impact, but apparently it is not. Barry Popkin and others have done some very good research documenting the impact of these taxes. Philadelphia has a tax of 1.75 cents per ounce on any beverage with added sugar, which is a whopping tax compared to what we talked about, and Mayor Kenny got it through. So that tax is now in effect and people are beginning to evaluate it. So to me, the strategic research that we did here was the conceptual part of it, laying out the public health and economic arguments, but then the revenue calculator and the elasticity data that would show how much consumption would change with certain taxes. And so, again, to the extent this work had an impact on these taxes around the world, it seems to me that it's acting through these particular mechanisms. But again, it was identifying the change agents and people that were involved with legislators and finding out what was important to them, namely the revenue. Case study number 4 is a whole different set of issues, and it has to do with misleading labeling. Now, you may or may not remember, in 2009, the food industry launched a program called Smart Choices. What this was is the food industry got together mainly with itself and defined what good nutrition, what constituted good nutrition, and then would award this Smart Choices label to any product that met the criteria. But of course, you can imagine that they set very lax criteria. So a product like the cereal companies might set what looked to be very good standards with respect to fat, but fat is not an issue in these products, and they would set very lax standards with respect to sugar. Other companies where fat is more of an issue would do the reverse. So the criteria were so lax that things like these could be awarded the Smart Choices label. So I was thinking back, I was again in Connecticut at the time, and I was thinking about what might be done about this. Now about, 6 months or so before this, I don't remember the exact time, I'd written a letter to our Attorney General at the time, Richard Blumenthal, who's now a senator from Connecticut. And here's a picture of him. Attorney General Blumenthal had been a real hero in the tobacco wars. And I thought, if he'd worked so hard on tobacco and going after those companies, maybe he would be interested in doing something with food. So I just wrote him a blind letter, cold letter. I hadn't met him before. And much to my surprise, I got a call from his office not too long after the letter had been sent. And they said, he's very interested in meeting with you. He'll come to your office. So this came as a surprise, but boy, it was sure worth a try. So he came and met with me, and we hit it off and decided that we would try to do something in this arena, but we needed the right case, the right issue to tackle. so his staff could go to work on this. So along comes Smart Choices. So I call him and talk to him about this, and he said, let me have my staff attorneys look into it. He did. And then he called me back and he said, basically, let's go get them, which was an incredibly exciting thing for an academic to do. I mean, how often is our world that exciting? So he gets in touch, says, let's go get them. So we did. I mean, we didn't, he did. And so he launched an official investigation into the Smart Choices program. He had a press conference where he held up a box of Fruit Loops, as I recall, and he said, should the citizens of Connecticut be told this is a smart choice? Something is wrong here. I'm going to get to the bottom of it. So the official investigation, the launch, the press conference got a lot of attention. At the same time, the New York Times found out about all this going on and wrote an article that was critical of the Smart Choices program. And then subsequently wrote another article on the heels of the first one that talked about the Connecticut Attorney General going after Smart Choices and mentioned that a number of other attorneys general were interested in potentially pursuing this. So, and the other thing that was very interesting in this, and some of you may know a little bit about this history, is that one of the premier nutrition organizations, the American Society of Nutrition, had taken a large amount of money from the Smart Choices people to administer the Smart Choices program. So this looked to me like conflicts of interest, and it looked to me like the industry wanted not to have its fingerprints on this and have it look like this was all derived from the work of this revered nutrition society. So this became known to Attorney General Blumenthal. So he issued demand letters, which are just short of a subpoena, to the companies demanding information on who paid who, where the money went, how a process was followed to derive these criteria. But he also issued demand letters to the officers of the American Society of Nutrition. And those are people like you and me. And the companies are used to hearing from attorneys general, but we're not. And so this created a real crisis of public relations in these two orbits, the industry orbit and the world of the scientists. So in a very short period of time, in 2009, a series of things happened. One is on September 4th, there was a critical New York Times article. Connecticut Attorney General launched, made the official launch of his investigation in October, but it was that investigation that prompted the New York Times article in the first place. Commissioner of the FDA had a public phone call that was critical of the Smart Choices program, and in October, the industry closed the program down. Scarcely 6 weeks after it had been launched, with large investment. So they stopped printing boxes with the Smart Choices label and things like that. Now, what went on here? The companies could have easily weathered the storm created by the Attorney General if this was only a legal issue, because they could have stalled, they could have held out, they could have drawn out the process beyond the point where Smart Choices had any value to them anymore. These things all have a shelf life, if you will. And they could have weathered that, but it was the public relations that became a problem for them. And they didn't want to keep getting bad public relations, so they pulled the plug on the program, which was interesting. And so, if you look at the pathways to impact here, it would be through the press and the public relations and a legal authority taking action. And so if you think back about these 4 case examples, in each case, the change agent was really very different. In each case, the type of information that got generated to help the change agent was very different, but we hope in each case there was some social and policy impact. So going back to our model, identifying the change agents, you saw how we did that in each of the 4 cases. The change agents helped us define what the strategic questions were. We then conducted the research, sometimes very quickly and inexpensively. We published it in peer-reviewed journals to give it credibility and to show that the science was well done. but other scientists were not necessarily the intended audience. And so there was a whole set of communications done beyond just publishing things in journals. And the communications were traditional things like press releases and policy briefs, but they involved a lot of discussions with these change agents in hopes of creating this virtuous set of changes. So there are a ton of interesting strategic questions out there now, and all of you in your area will have your own. But it's very interesting to think about what some of these might be. Now, some of the issues we're thinking about, for example, are the preemption issue I stated before. When companies are unhappy about legislation that's unfavorable to them at the local level, they'll go to the state or the federal government and ask that legislation gets passed that preempts other bodies of government, lower bodies of government, for doing something on their own. This is particularly toxic because it rules out local ingenuity in different ways programs might get implemented. And if there is a national standard, it's likely to be a weak one and likely to be ineffective because it has to apply across the whole country. So figuring out how to preempt the preemption becomes a very important strategic question. So we can ask ourselves who ultimately will make preemption decisions and what important information might we provide them in order to help fight this off as a threat. Another example is the threat of industry running candidates for office. So in Philadelphia, for example, now that they have the tax, the industry wants to have the tax repealed. They fought it in the courts, but unsuccessfully, so the Pennsylvania Supreme Court supported the tax. So what can they do? They can run candidates for office. And it doesn't cost very much to run somebody for a city council spot. I mean, a trivial amount of money for industry. So how can research be done that might help fight this off as a threat? Well, there's public opinion polling and framing research that could be done in order for the opponents of the industry-funded candidates to dismantle their arguments, to show that they're funded by industry, et cetera, in order to create maximum likelihood that they get elected to office. Another interesting issue is food policy as political platform. And we learned this in an interesting way. So this World Food Policy Center that we've created at Duke, I was discussing this with a person who was a city council member in the city of Durham, but teaching part-time for us in the school. His name was Steve Schewel, about this World Food Policy Center, and he was quite interested as a member of city council, but then he ran for mayor. And he used this World Food Policy Center, this model food community concept, as part of his political platform in his campaign, which we were delighted by. And then he got elected as mayor and now is a very helpful ally in this model food community's work we're doing. So there's some very interesting strategic research to be done about how politicians can frame these issues in order to get elected to office. Not just around obesity prevention or sugar beverages or whatever it happens to be, but about broader food systems issues. And if Durham is any indication, this looks like this might be a winning political issue. But how helpful would it be to somebody who's running for office in Topeka or Detroit or Spokane to know what the framing research is and what the public opinion research is that could be done for them that would be helpful in them framing the argument? And how neat would it be to have a research center at the ready to help these politicians collect data on public opinion in their territory? That could be done very quickly, relatively inexpensively, and could have great impact in those areas. So I'll end there and just review a few things. One is that, again, I'm very happy to come to Hopkins and deliver this lecture. This will be something I'll remember for a long time and feel very proud of. So thank you again for inviting me. Our hope in this work, now again, it's a strange kind of talk you've heard here today because, you know, I could have talked about the World Food Policy thing and said, here's why we're doing it, here's what we're doing, number 1, 2, and 3. But this was about a broader concept. And so some of the issues I talked about today, menu labeling, marketing to kids, may have nothing at all to do with your work, but I hope the model was instructive and helpful in some way. And if the model applies, then I hope I would have created a little impact today, like we're hoping to create in the bigger world. And I think we can do that by identifying the change agents, being informed by them as we do our research, and learn how to better reinforce that activity in academic settings, both in our training and in the way we evaluate people as they go through their academic careers. So thank you very much. Okay, I've been told there are time for questions.
Short, and the answer is short, and we'll get a lot in.
Okay, thanks. I promise to give short answers. I'll do my part. She has the microphone over there.
I think you can hear me and maybe repeat the question.
Okay.
It has to do with professional societies, because it looked like in your list of agents of change, professional societies are not there. You mentioned the example of ASN, but I wonder if you could comment on how do you see the role of professional societies, one way or the other? Okay.
So I'll repeat the question quickly. So Ben asked the question about what about professional societies, because it wasn't in my list of change agents. It's just because I didn't have enough room on the slide to list all the potential change agents. But if I had, professional societies would have been on that list, because they're in a position to do something. And you think about some of the activism-oriented professional societies, like the American Academy of Pediatrics, for example, and some of the heart-related professional societies. Some of them have done some very impressive things in this area. So as long as conflicts of interest don't get in the way, some of those societies can be very, very helpful, I think. So I'm glad you raised the question, and it was just not enough room. Yes.
Hi, Ingrid Kolstadt here. Thank you very much for the really interesting talk. Your new center at Duke has agriculture involved in it. So I wondered if you were going to be applying these models to agriculture. And I wanted your recap in your terms and flow sheets, your diagram here, for what happened in August of this year with Monsanto and glyphosates, where the jury concluded that we don't know what the science says, but we know that these people were not playing above board, and the science and the research was held back. So therefore, they're going to be, quote, guilty of not letting the science go forward. If you could add your perspective in this framework to that court decision. Appreciate it.
Yeah, so that particular court decision I'm about as familiar with as what you just said, so I can't offer any expert opinion on that specifically. But in general, I can say the courts are very powerful in this. And the example that we've seen locally in North Carolina are a series of court cases you may have heard about, where the hog farmers and Smithfield, the big integrator, the big company that gives contracts to the farmers, were sued on the grounds of public nuisance because the people living around the farms were being adversely affected, presumably by the waste disposal and things like that. And these are hundreds of millions of dollars of lawsuits that have been settled against Smithfield, which is a massive company. That was before the storm. And I spent a lot of time now with some of the farmers and the people in that industry, and they view this as an existential crisis. So I'm not sure what the right outcome of this. I mean, a good outcome would be better disposal of the waste. That's better for both the environment and for the people living in the area. That's pretty obvious. But there are a lot of engineering complexities to all that. But the courts have been the change agent. So environmental research has been done for years and years. That didn't change things. Public groups have complained about this. That didn't change things, but the lawsuits did. So it's very interesting to think about the legal system as a change agent in some areas, and they can really make a big difference. And they can also get in the way, like with the case of preemption or blocking the research on things. So thank you for the question.
Hi, I'm Erin Hager from the University of Maryland School of Medicine. It was a wonderful talk. And you first released the Strategic Science Framework in 2005, and I've heard you speak about it before. Have you seen any movement, either in your institution or in other institutions, around valuing this type of work in the promotion and tenure process and things like that? Because I think the framework the prior to that with the slowness of science was really there, and we kind of keep valuing papers and grants over some of the things you're talking
Yeah,
about.
so the world I can speak about with most precision would be schools of public policy, because I've now been in one for going on 6 years. And in our school, we're talking about that a lot. And there's a lot of discussion about how do you quantify impact in that way. I mean, it's sort of now a given that this kind of work counts, and it's important to be considered. And the question isn't so much whether, but how you specify and how you quantify it. And I see that as a very important advance. Now, I can't say what's happening in schools of public health. I'd be surprised if those discussions aren't occurring in some way, but I don't know specifically. But my guess is that more and more people are thinking about those things, and I see that as a positive development. And once it's built into the reward structure, then it'll get reflected in training, it'll get reflected in hiring practices and things like that, which really could help change the landscape a lot. So I'm not talking about strategic science as replacing programmatic research. Heaven knows we need the programmatic research, but I'm just arguing that that may not be the only thing the field does. Keith? Oh, it's right behind you.
So in your first example, you listed healthy cereals that have no advertising going on, and then the sweetened ones that had all the advertising to kids. Can you give us an example of how the industry could be change agents for advertising, lowering prices? How do you recommend them to push their healthy foods and decrease one, but move the healthy foods forward in terms of advertising or promoting consumption?
Right. So it's a very good question, and there's, I believe, I don't know that I'm an expert on industry behavior, but from what I've observed, there's a carrot and a stick there. On the carrot side, the industry is responding to changes in consumer demand. So all these, that's why they have healthier cereals in the first place, and the soda companies have healthier versions of their beverages, and you can get a salad at the fast food places. They don't want to miss that segment of the market, and they see that as growing, so they want to have that available. But they don't necessarily want to push that ahead of their flagship products, because the profit margin is high, tends to be higher on those. And they've had years and years and years of cultivating brand loyalty with those things, and they don't want to sacrifice that. So the carrot will get you partway to the goal line, but not all the way, and that's where the stick comes in. And the stick could be adverse public opinion about their practices, where they'll have to change. It could be change agents like an attorney general. It could be legislation and things like that. So I'd say a combination of the carrot and stick has to be applied. Because above all, they're responsible to their shareholders, and if anything interferes with them making money, they're just simply not going to do it unless they have to.
Hi, I'm Karen Thomas. I'm the school historian, and my question is about the sugar-sweetened beverage taxes. I noticed that there were no cities, except maybe on the West Coast, that were below Philadelphia. And of course, the rates of obesity and soda consumption are highest in the South. And I was wondering if you have any thoughts on how to tackle that difficult problem.
Yeah. Boy, I'm not sure I understand the tobacco history exactly, but my guess is it's going to parallel exactly that. The states in the South are very slow to react to public health measures that might help people, with tobacco taxes being an example. In North Carolina, I don't know what it is in Maryland, but in North Carolina, you can still drive around in your car talking on your cell phone up to your ear and not having to do it remotely. It's just this don't tell us what to do mentality that exists a little bit in North Carolina, exists a lot south of us, and then going to Texas and places like that. So my sense is that those places will be hard to get something done quickly, and it's only in doing things in a lot of other places around it and collecting data on it, you might provide a persuasive case ultimately for those states to do things. So even though I've been very devoted to the soda tax work, in the model food communities work in Durham, we're not talking about that at all, because I think it would get in the way of accomplishing other things. Yes.
Hi. Oh. Okay.
Go ahead.
My name's Jessie Silverman. I'm a second-year master's student here in human nutrition, and thank you for your talk today. The strategic science framework really appeals to me as someone who wants to influence nutrition policy in my career, but I can't help but wonder if the model is maybe vulnerable to bias in the way that the food industry's strategic science agenda is, and I was wondering if you could comment on how you think about that.
I'm completely open to that likelihood. It's probably hard to imagine there's no bias baked into it at all. We're all human beings and have our own biases. So that will show up in the questions we choose to ask. It will show up in who we interact with as change agents and things like that. So yes, I definitely accept that as a possibility. I appreciate you raising that. Our hope is that, and we never push ahead with anything that's not peer reviewed, so we hope that the quality of the science, has the highest level of what the sort of our own industry standard, if you will. It meets that, but certainly bias enters the picture. There's no question about it.
Well, I was going to ask a question as well, but I'm so pleased that the student asked the question I wanted to ask. But I would expand on it, and that is to say that my experience over the years has been that the industry is very successful in pushing back in terms of the research they fund and ultimately the ability to create confusion surrounding a particular issue that tends to obviate or mitigate any of the success that we've had. And as a result, we have this problem, as well as I struggle over how best to protect the research from this type of corrosive action over the years. So I was wondering if, and let me also say that it was a wonderful lecture, and very much appreciate your being with us.
That. So yeah, it's a terrific question about industry influence, and boy, we've struggled with this for years and years. I'm because of the work we're doing has changed a bit from the earlier. My relationship with industry has changed from outright combat to more trying to understand what goes on in industry and trying to see whether there's anything that might be done in certain select areas where we could work with them on things. But in the past days, it was outright combat, as I said. And one of the papers in my career I'm most proud of is one I wrote with the Ken Warner, who I mentioned before, from the University of Michigan. And we looked at the scripts of the tobacco industry and the food industry. So we laid out all the things the tobacco industry had done when they were fighting public health measures and looked at what the food industry has done. It's check, check, check. It's just exactly the same. And so exposing the industry technique, sometimes preemptively through the press, can be helpful. But you're right, they have a corrosive impact, they can often undermine things, and planting doubt is one of their chief tactics. When I get discouraged about that, I think back to tobacco. And there was a time when tobacco was just the huge powerhouse, and nobody could have ever imagined doing anything against the tobacco companies. And look what's happened. It's taken a long time, but who would have ever imagined back in the 1950s or early 60s, very high taxes, banning smoking in public places and the like, and lawsuits against the companies by the state attorneys general. But all those things happened, and the reputation of the companies changed as a consequence. So I see that same phenomenon happening in the food industry. Now, it might be because that's what I want to see, but it seems to me that those things are going on. So I take heart in that. And I think the strong and select and strategic activities by a small group of researchers can make a big difference ultimately. And it's happened in other areas, and I think it can happen here too. At least that's what we hope. So again, thank you very much.
Kelly, thank you so much. We have always tried to make the Graham Lecture one that is provocative, and you have held it to its highest standard today. So we very much appreciate it. I forgot to thank our sponsors of this Graham Lecture, which is the International Fund for Infant Nutrition, the Mittendorf Foundation, and Dr. and Mrs. T.C. Wu, who have been generous contributors to this lectureship. So thank you again. It was a wonderful talk. We are going to take a 10-minute stretch and shuttle intermission, and we'll be starting our afternoon symposium in 10 minutes. So we encourage you to stretch and come back to your seat as quickly as you possibly can. Thank you very much. Okay. Believe it or not, we actually built in a buffer on this because I knew it wouldn't be exactly 10 minutes. So we are now into our second phase of today's program entitled our Hopkins Nutrition Centennial Symposium. And we have, this is for those of you who have seen this poster, it's the second part of our program. This is the program that sits before you. And we have a dynamic range that is truly impressive, along with the kinds of speakers. The speakers that we have are equally impressive as the topics. To give a sampling of the issues that are both being researched today and led by Hopkins researchers with global implications. At the same time, we're looking back at what has transpired over the past century in a mere 20 minutes. And so we're looking back, we're looking at what we are today, and we have a view forward as well. So we are trying to create an intersection of knowing where we've been so we know where we are going, and use that as a springboard for thinking about our own research and directions that we want to go in the coming years. So I would ask, I think all of our speakers have their slides ready. And I am going to, we're going to split this up into two sessions. We do have a stretch break in an hour. We want you to hang in here with us. It was very difficult to put these talks together in a relatively small amount of time and still create the impression that we want. So I'm going to ask our first set of speakers before the break to just come up. I will not get up every time and do an announcement because we want to take advantage of the time that the speakers have with all of us. So, so we have Dr. Karen Thomas, who's going to discuss with us the nutrition legacies and leadership here at Hopkins in the past century. We have Dr. Larry Apple, the architect of the DASH diet, and its achievements, accomplishments, and its road ahead. And then we have Dr. Jed Fahey, who's going to talk to us about how phytochemicals power up vegetables for health. And so without further ado, I would like to ask Karen to come on up and share with us your talk. I would ask our speakers to please stay within 16 minutes or so we have a few questions for time, a few minutes for questions and answers. And if you go the whole time, we just won't have the time for Q&A. But that's, we're going to have to stay on time. Thank you so much for coming, Karen.
Where's the mouse? Good afternoon. I am very proud to introduce to you E.V. McCollum's rat. Schrodinger had his cat, and E.V. McCollum had his rat. McCollum introduced nutritional research using rats, and this rat has really been gotten around. He became a kind of mascot for nutrition research, and he would pop up in different offices sometimes in students' lockers who are new to the school, things like that. But he will be presiding over the rest of the symposium. So picture a young Evie McCullum at age 38 coming to the school, standing on the steps of the historic Wolf Street entrance, except then it was the only entrance. And I mean, he's adorable. Look at him. And in 1917, when he arrived, a lot of public health and medical advancements were still far in the future. Nutrition, which McCullum had been pioneering over the past 5 years or so, held great hope. And I think that's why William Henry Welch, the first dean of both medicine and public health, brought McCullum to the school as the very first faculty member hired. That promise of nutrition. So in his book, The History of Nutrition, McCullum looked back and said that this new knowledge that's been brought about by nutrition research and that you're continuing today here, it's brought about the improvement of health and its attendant elevation of the status of human life. And then he says, to a degree scarcely equaled by any other agency. So he's kind of putting a stake in the ground here, or a flag in the ground. He says, nutrition is where it's at. Nutrition holds the greatest hope of improving health. And he was looking back from 1957, so that's after penicillin, after many of the immunizations. But keep that in mind as we go forward through the next 100 years. So McCullum was born in 1879, and he, as I think everybody in this room knows, was the co-discoverer. He did have an assistant at University of Wisconsin who helped him discover vitamin A in 1913. And then here at Johns Hopkins, he discovered vitamin D and identified vitamin D deficiency as the cause of rickets, which is a very widespread nutritional deficiency. And you saw children all over the country, but especially in the South, where poverty and malnutrition was rampant because especially the sharecroppers grew their crops right up to the door. And they could only grow cotton, which was the cash crop, and they didn't grow food to feed themselves. So rickets was a real problem, and it was a problem here in Baltimore. So he not only discovered vitamin D, but he developed methods to get kids to eat, things containing vitamin D so that they could not have that happen to them. So you can either thank or curse McCullum, as he's kind of the father of cod liver oil, which is a very, very common. If you grew up earlier in the 20th century or mid to 20th century, you knew about cod liver oil because your mother would give it to you a lot. But he also, as these different vitamins were being discovered, he helped to identify the standards by which, and the letter nomenclature for these new different vitamins that were being discovered one after another. And so I think McCullum gives us 4 major themes that are going to go through the lecture. He was a consummate scientist. He was a master of the science of biochemistry, which was very new and also very prestigious at the school's beginnings. And William Henry Welch, who was certainly a promoter of scientists and a great scientist himself, recognized that. So science. He also, though, recognized the importance of epidemiology and large-scale studies. He could translate his scientific discoveries to a popular audience and educate and persuade large numbers of people that most needed the information. So his ability to translate and educate people was central to what he did. There's a 4th one, but I'll have to move on. Sorry. Something that's really notable about McCollum and the Department of Biochemistry under him is that there are a large number of female students who came to work under McCollum, and a lot of them, got their start in the Department of Biochemistry. And this was when many medical schools were closed to women, and even the school here was largely populated by male doctors and a few stray scientists here and there as well. So his commitment to training female scientists all the way back in the 19 teens was really unusual. But not only did he teach women, he also partnered with women. So one of his main collaborators was Nina Simmons, who was his co-author on many of his textbooks. Being from Wisconsin, McCollum felt that milk was a superfood. So long before kale, he felt that milk was really the greatest tool for nutrition. And he also, even though he was nicknamed Dr. Vitamin by Time magazine, at the time, a lot of companies began to try to cash in on sort of the vitamin craze. And these companies made very outsized claims that were probably not warranted by scientific evidence. And so McCollum was rather skeptical of these mass marketing of what he views as not really proven vitamin capsules. I think with respect to many folks here, the supplement industry has really come a long way since the days of McCollum. So in addition to his students and his collaborators, women were a key popular audience for McCollum as well. And he was an editor for popular magazines like McCall's and Parents. He wrote columns for them to really encourage women, who were the main keepers of children's diets at that point, to use good nutritional principles in their childbearing. So, these are some of the things he suggested. Use eggs and meat frequently, but not excessively. Serve one leafy vegetable, like beets, kale, spinach, and so forth, each day. This was back in the 1920s, so he was quite ahead of the game. So one of McCollum's early hires on the biochemistry faculty was Bacon F. Chow. Actually, he wasn't early. He came to the school in 1949. But I would say, I'm sorry, it's pronounced Joe, forgive me. Bacon Joe was probably McCollum's most influential colleague in the department. He was on the faculty from 1949 to 73. And he's most famous for his study of 14 Taiwanese villages in the late 60s. And he was going beyond just the lab and the bench scientists, just as his chair had done. And he was looking at the effects of inadequate nutrition during pregnancy in both rats and what happened to the pups, and in human beings. So after establishing the importance of protein in maternal diets with the rat studies, he established that adequate maternal protein would prevent premature birth and would ensure normal growth and development. And Joe was also really a pivot in the history of nutrition research here, because it had been exclusively based in biochemistry. It had been focused very much on domestic research, and then Joe took it overseas to Taiwan. And then finally, the nutrition research had mainly been done in rats, and Joe took it to the next level to human research. So he was really a very important transitional figure. After the Cold War really kicks in, nutrition research shifts to the Department of International Health and the global arena. Something that really interests me is that all the way back in the 1930s, there were two, both alums and faculty members, they were actually parasitologists, but they were involved in the early hookworm research, and they did research in dogs that showed that dogs who were fed poorer diets were more likely to get hookworm infection. So that was really the very first identification of the connections between malnutrition and susceptibility to infection that becomes a major pillar of the school's work all the way through to today. So it was really Carl Taylor who takes that idea and elevates it to a much more prominent place. So Taylor had been born in India, was a child, like many faculty, was the child of missionaries, and he was the founding chair of International Health, which was the division was founded in 1962. Nutrition research, biochemistry in the 50s really turns heavily into molecular biology, and biochemistry, teaching students to do these experiments on rats had been a requirement from the earliest days of the school until the 1940s, but they actually dropped that requirement after World War II. So biochemistry remains a fairly small department. It's headed by Roger Harriot, who's a brilliant biochemist, but he does research on DNA, and he's turns the department away from nutrition. So it's really an international health from here on out. So nutrition becomes central to the Department of International Health's work in the 60s. And interestingly, Taylor also established the school's connections in Nepal, which, as you'll see later, is very important in the story as well. So his Naringwal studies in India from 1964 to 74, instead of taking nutrition just in isolation, he combines it with primary care and family planning and looks at it as a package, and he tries different combinations, and he establishes that the combination of those three things is not only the most effective in promoting health, but it's also the cheapest. So I'm going to move quickly here. So in 68, the Interactions of Nutrition and Infection textbook comes out, and that is an important turning point. And we have Alfred Haynes on the International Health faculty, who is not only the first African-American full professor at JHU, he took his international health knowledge, he worked in India and Africa, and applies it to the problem of malnutrition in the United States. And there has been a bi-directional flow of research, I think, ever since that is really interesting and not always typical. George Graham was not only the founder, for whom the Graham Lecture is named, I should importantly add. He founded the Institute for Nutrition Research in Peru, and most of his work was in Peru. But he is also the founding director of the Division of Human Nutrition. And it's George Graham and David Page, who is then in maternal and child health, now PFRH, and I believe he's in the audience. It's Graham and Page that bring nutrition research into the political arena. And so Graham, for his part, was a Republican, and he was on Ronald Reagan's task force on food assistance. So that kind of recalls McCollum's role during World War I on food policy during the war. David Page really raises the level of advocacy on nutrition. And although he's not in international health as his primary appointment, he certainly is a major figure in nutrition research. And he noticed that infants in the Johns Hopkins pediatric ER were iron deficient, and he felt that, well, they don't really need medicine, they need food. They need nutritious food to be able to reverse the iron deficiency. So he founded first a city, then a statewide program that became one of the pilots for the Women, Infant, and Children program, which of course is a landmark program in health and welfare in the United States. And if you see the picture on the left, part of the reason for the iron deficiency was that the formula, which companies were marketing heavily to the American public, poor families were watering the formula down with water to make it last longer, and that's why the infants were becoming iron deficient. So we get to the king of A and the king of Z. Alfred Sommer, who of course was dean of the school from 1990 to 2005, pioneered with Keith West, his student, in trials of vitamin A, first in Indonesia, that established conclusively that a very cheap dose of vitamin A could not only reduce child mortality, and of course prevent blindness, which is what the research originally set out to do, but that later on they find that vitamin A has all sorts of other benefits. So the work in Indonesia was kind of like planting a seedling, and then that has really become a giant tree with roots going out in all sorts of different directions in the department. And he won a Lasker Award for that work, by the way. So in the early 80s, when so Keith West comes in the early 80s, Al Sommer had been in medicine, but is working closely with public health in the 80s. And then Bob Black becomes chair of international health in 1985, a position he'll hold for the next 30 years. And he documents the long-term effects of childhood malnutrition, but he looks at zinc as a major factor in preventing and treating childhood diarrhea, and then later also pneumonia and reducing child mortality. So between Sommer and West's work on vitamin A and Black's work on zinc and other micronutrients, that's how basically the empire of micronutrient research is established here in the department at the school. Ben Caballero, I have got a very short amount of time left, so I'm going to very quickly go through this. He's the founding director of the Center of Human Nutrition, and he also he goes into the science side of what I was talking about before. He looks at biomarkers for nutritional deficiency, and he's also one of the first to really look at diet-related chronic disease in developing countries. And he also identifies the paradox of both underweight and overweight as serious nutrition problems in these countries. And finally, in 2013, he becomes the founding director of the Global Obesity Prevention Center. And his influence is really tremendous. He's written many textbooks that have won major awards, and I would say he's really made his mark in the educational field as well as the research field. So I will just end with the NIPS project, and I can circulate this presentation later so you can look at the details. But the NIPS project is led in the first two studies by Keith West, but brings in an array of really strong researchers, including Joanne Katz and Parole Christian, who just continue to expand on vitamin A research with maternal diets, with both infants and young children, and just continues to expand the knowledge of the power of vitamin A as a cheap and very cost-effective intervention in global health. And Keith's work continues to break new ground, and his discovery of reducing maternal mortality among Nepalese, just general mortality among Nepalese women by 40%, and especially the Javita project, which is really where we are today, the Javita Project has revolutionized nutrition research and is, the center of the Center on Human Nutrition for the last several decades. And more recently, his POSHAN, is that the correct way to pronounce it, Keith? Yeah, the POSHAN study has looked at the connection between agriculture and nutrition. And in that way, he's really gone back to the roots of McCullum, who, as we remember, came from a school of agriculture and was looking at milk and dairy farmers as the beginning of his research. So now with the Center for a Livable Future and this research, we're really coming back to some of those roots. Thank you very much. And we have a terrific history here, and I hope you'll learn more about it. Thank you.
I've already introduced you. Well, it's quite a tradition to follow. So my name's Larry Apple, and my primary appointment is the School of Medicine, but I've had friends and colleagues in the School of Public Health, including International Health, and I do want to acknowledge, first of all, the pivotal role of International Health, particularly Ben Cavallero in the DASH study. He assisted me in preparing the grant when I was wet behind the ears as a Green faculty member. He identified the place where we were going to, a metabolic kitchen, which we didn't have. It's very interesting to apply for a grant to do a feeding study when you don't have a metabolic kitchen, but I did it, and Ben helped. And then he actually proposed the title. Initially, it was Dietary Alternatives to Stop Hypertension, and then I corrected him. It was Dietary Approaches to Stop Hypertension. So this is what I'm going to cover very briefly. The pandemic of elevated blood pressure. I'll discuss DASH and some reflection and aspirations. What would we have done differently? And translation and future research. So worldwide, hypertension is an enormous problem. Its prevalence is about 31% of adults. That's 1.4 billion individuals. It's prevalent in high-income countries and in low and middle-income countries, roughly the same amount. But most of the persons with hypertension live in low and middle-income countries. It caught me by surprise, but the global burden of disease has estimated that high systolic blood pressure is the leading cause of preventable deaths worldwide, even exceeding smoking and other preventable causes. This is true whether it's high or low middle income countries. While there, of course, has been appropriate attention to other causes of disease or mortality, high blood pressure has been estimated to be the leading cause, which is great for job security, by the way, if you want to, have a good career. So it's been estimated that about a half of strokes, half of coronary heart disease attribute to elevated blood pressure, and I always like bringing this up, that the lifetime risk of developing is 90%. So you in the audience, it's not just a theoretical issue, it's likely that most of you or all of us will actually develop it over our lifetime. So now, DASH, how does it fit in? So we did this clinical study. It's a randomized controlled feeding study at 4 clinical centers and a coordinating center at Kaiser. And I have to bring it back to 1980, the knowledge that we had when we were designing DASH. So at that point, it appeared that multiple dietary factors might affect blood pressure. There is persuasive evidence on salt, excess weight, and high alcohol intake. But there was a really confusing and very inconsistent body of evidence. Looked like vegetarian diets might lower blood pressure, and there were actually 2 clinical trials that had been done. And then as for nutrients, appeared that higher potassium, magnesium, and calcium were associated with lower blood pressure in some but not all studies, and that certain macronutrients might also lower blood pressure, higher protein, more fish oil, fiber, and lower cholesterol. So the objective of DASH was to determine the effects on blood pressure of modifying whole dietary patterns while controlling known determinants of blood pressure. And this was in adults with pre or stage 1 hypertension. So this was a randomized controlled feeding study. Individuals who had pre or stage 1 hypertension initially ate a controlled diet for 3 weeks, and then they were randomized to either continue the controlled diet or they were randomized to a diet which was called the fruit and vegetable diet, and then a third diet, which is now termed the DASH diet. It originally was called a combination diet, and that period was 8 weeks. So we fed individuals for a total of 11 weeks. And these are the nutrient targets for each of the 3 diets. So I'll just go over the DASH diet. And that it was somewhat reduced in fat, 27% of calories from fat, 6% of calories from saturated fat. It was actually a high carbohydrate diet. 55% of calories came from carbohydrate, 18% from protein, 31 grams of fiber, and it was also very high in micronutrients, cations, potassium, magnesium, calcium, and by design we kept sodium constant. So we were looking at the effects of this pattern while holding constant sodium. We also kept weight constant, and we have a very sedentary society, so people were sedentary at the beginning, middle, and end. We didn't have to worry about that as people running marathons. So if you look at it a different way, these were the servings per day of food groups. So the DASH diet in green was high in fruits and vegetables. At that point, we didn't know how to count, and so we actually included fruit juices in that. But so that was about, on average, 9 servings of fruits and vegetables per day compared to the control diet, which was just under 4. It had low-fat dairy products, around 3 per day. It was reduced in meat, fish and poultry, and also reduced in fats and oils. So even though I just described the nutrient profile as well as the food profile, I think this is how you would describe it if you were to talk to somebody. So this is a diet that emphasizes fruits, vegetables, and low-fat dairy food. It includes whole grains, nuts, poultry, and fish, and is reduced in saturated fat, meat, red meat, sweets, and sugar-containing beverages. So it was that we enrolled just under 460 individuals. About half were women, half men. Because of the high prevalence of elevated blood pressure and its adverse consequences, we enrolled about 60% of participants who were African American. Average age was 45. This is average blood pressure, 132/85, and about a third, or just under a third, were hypertensive, and people were in the overweight range of BMI. So these were the main study results. This is the red line is the control diet, the green line the DASH diet, the yellow line in between was the fruit and vegetable diet. And you saw basically this graded response. Mean difference between control and DASH was about 5 millimeters of mercury systolic, which was actually pretty large for a non-drug therapy. But there were really impressive subgroup findings. So the DASH diet lowered blood pressure in virtually all subgroups, but there are 2 interactions that suggest particular benefit. The first was in African Americans, and the second was in people who had hypertension. So these are the results in African Americans. And this is, to me, one of the most important findings of DASH is that we have a means to lower, not just documented disparity, but a means to reduce disparity. So African Americans, on average, had greater blood pressure reduction, 6.9 systolic compared to 3.3 systolic in non-African Americans. And we saw the same pattern for diastolic blood pressure, and this was statistically significant. Now, if you look at the pattern of blood pressure change in hypertensive patients, the average difference between the control diet and the DASH diet in people who had hypertension at baseline was huge. It was 11, which caught a lot of people by surprise, and it was really quite striking because that's the equivalent of drug therapy. And so I think this is why it got traction so fast. 11 millimeters of mercury is really quite substantial. It did have effects on lipids. It lowered total cholesterol, LDL. HDL is often called the good cholesterol, but on the other hand, we really don't know how to interpret diet-induced changes in HDL. Some people actually don't believe this has any clinical significance. This is the biomarker that we accept for CVD risk, LDL cholesterol, and it had a neutral effect on triglycerides. So there's a lot of speculation about what caused the blood pressure reductions. This trial was really not designed to isolate either a nutrient or food group that might be responsible, but these are the potential candidates for initially the fruit and vegetable effect, fruits, vegetables, nuts, fewer snacks and sweets. And then there was this additional effect of the DASH diet beyond the fruit and vegetable diet. So it could be some slightly more vegetables, some dairy products, fish, less meat, less saturated fat, fewer snacks, or nutrient interactions, which is always a possibility, but hard to prove. And again, this has been a matter of speculation. To me, it was actually a bit disconcerting because some industries said it was their food that led to the reduction. So the dairy industry, for example, say they had a phrase, "Dairy made the difference," in DASH. But there's no way to prove it in this study, and I'm a bit skeptical of that relationship. So now DASH was a randomized controlled feeding study, short duration with blood pressure and other, as the primary outcome and other surrogate outcomes. When you have to go to cohort studies to understand if DASH might have an impact on hard outcomes. And so these were data from a paper 2 years ago, last year, which documented that as with increasing adherence to the DASH diet, actually in this case it was sort of a change in the DASH score, you got greater reduction. In this case it was all-cause mortality. I'm not quite sure if this group actually got worse, but in any case positive changes were associated with a reduced risk of total mortality. So in summary, DASH diet lowers blood pressure with especially prominent effects in hypertensives and African Americans. It lowers LDL cholesterol, and we estimated that it should reduce coronary heart disease risk by about 15% when you plug in the average changes into the Framingham risk score. So that's what the talk that I would give if I were just to say this is what we found. So, I think what's interesting at a presentation like this is, well, what are the implications and what would you do differently if you were to redo the study? So some of the strengths of our study is, well, it's isocaloric feeding. We kept weight and other potential confounders controlled. We had really great adherence and follow-up. Participants were fantastic at all 4 sites. These studies can have really efficient designs, including crossover studies, which we implemented in the next wave of feeding studies. And it's a platform to understand biological effects of the diets. And we've done many sort of secondary analysis. And I can just tell you, for example, that we've done secondary analysis recently examining metabolomics, the effects of the diets on metabolomics. Casey Rebholz has done that. Noel Mueller has examined the effect of the diets on short-chain fatty acids. So these are great studies that with both public health importance as well as capacity to help understand basic biology. So there are limitations. Short duration of feeding, maximum feeding in any of our studies has been 6 months. Maximum duration of any one period has been about 8 weeks. We have to rely on surrogate markers. It's hard. We do not have the capacity to test the effect on clinical outcomes. and small sample size relative to outcome trials and cohort studies. And the expense, close to $8 million in DASH and about $12 million in the sequel, which was called DASH Sodium trial. And I can tell you, it was, while I was a junior investigator, it was very disconcerting to end my first trial with a $100,000 budget deficit, which I came out of, but it was not a very good feeling. So what should we have done differently besides having a budget that balanced? Alternate nutrient, I think one of this is sort of a nuts and bolts issue. I think we would have done things a bit different. How we estimated the targets, I think, looking back, I think we were a bit wrong. Potassium goal was too high. We thought it was the 95th percentile. I actually think it was even higher than that. And we had no omega-3 or fish oil goal in the trial. We did not deal at all with culinary issues. You know, we were scrambled to get the diets done and feed people, but we didn't really focus on taste issues, which I think is, you know, obviously quite important, and I think important for the next wave. We didn't deal with cost issues that, you know, that individuals would assume. I still think that most of the diets would have been reasonable, but we didn't purposely aim for lower cost diets. And finally, we didn't really address the environmental consequences of the types of the overall pattern. This is sort of an interesting issue because I know it's dealt with a lot by the Center for Livable Future. When I was on vacation, I heard about this study, and then I subsequently got a paper. And basically, it was an analysis of, well, what would happen in terms of land use if all countries in the world adopted the U.S. dietary guidelines? And the point was that perhaps in countries in blue, there would be actually a reduction in land that was required to produce food. But in most countries of the world, in green and red, there was actually an increase in the need for land that would be used to generate food. So I think this is just one dimension of the potential environmental consequences of proceeding towards a healthy diet similar to the one that we have advocated in the United States. So as for future research, this is some of the research that I would love to do myself, but I think that at this point in my career it's likely to be other people who do this. I think there is, and this is, I think, relevant to the last speaker today, there's a need to develop and test culturally relevant, healthy dietary patterns in non-Western countries. There is no such thing as a DASH diet equivalent in Japan or China, as far as I know, but I think that there's likely to be a pattern that is viewed as healthy, may have to be, you know, developed or constructed the same that we did in DASH, and then it should be tested, find out what its effects on blood pressure, which I think is a universally relevant outcome variable. And then I think we have a dearth of information about the DASH diet, and I would also say reduced sodium in certain key populations, children, individuals with chronic kidney disease, people with heart failure, and type 2 diabetes. You know, unfortunately, these studies, which are, you know, are classic efficacy studies, are not in vogue at the NIH right now. Right now, there's this desire to have ultra inexpensive clinical trials, as well as effectiveness type studies, which certainly have a role. But I think that studies like DASH have been incredibly influential, and quite frankly, the price tag of $8 million I don't think would be considered high given the value of the studies. And then I think to modify DASH, I think that for me, one of the questions that has come up, and it's not because I'm anti-dairy, but I think that dairy is potentially a food group that is challenging for some populations to consume, but also has an adverse environmental impact. Do you need to, you know, provide your calcium through dairy, or could you get it through other calcium sources that would be could replace it? So in terms of translation, I take great pride in this. This is the number of citations per year for the two initial feeding studies we did, DASH, sodium. We did have tremendous impact, almost immediate, with publication of the hypertension guidelines, hypertension treatment guidelines, dietary guidelines for America. It's now one of the benchmark diets that is advocated along with a few other dietary patterns, and it's highlighted as well in the IOM report on electrolytes. So this is a little bit disconcerting. DASH diet is the best diet in the world. So why haven't you heard about it? Well, maybe in this room you heard about it, but a lot of people don't know about it. We're not as, it doesn't have the cachet of a South Beach diet or Atkins, but I still think it's I think it's slowly percolating through the media. So I'll finish up now. So Department of International Health had a pivotal role in DASH, helping secure the grant, designing, implementing the trial. The effects of DASH diet and blood pressure are substantial, especially among blacks and hypertensive individuals. Dietary changes do have the potential to dramatically reduce racial disparities, which I think is not fully appreciated. And with a cartoon from one of my staff members, you're eating too much fiber. So eat the control diet. So thank you very much. Question? One or two questions? Yes.
I have a question. So this great diet is spoken about so much, and I know dietitians still learn of the diet, nutritionists
Yep.
obviously thought about. I noticed that right now it's being used as a weight loss program diet, and folks are in that category. Can you speak to that?
Yeah. So that's an interesting. It was an isocaloric the way we tested it, so it didn't include weight loss, which I think was a good design issue for the study because it isolated the effect on the pattern rather than on reduction in calories. I think the way it sort of makes sense that if somebody's going to lose weight, you want them to eat a high quality diet. Now, can I say that the DASH diet actually contributes to weight loss? I can't prove that, but I think that the diet has certain features that might make it easier for individuals to lose weight, and that is it is really high in fiber. And I still remember talking to participants in the study who said, "I'm going to gain weight because you're giving me so much food, and I'm bloated, and I really can't eat anymore, and they're forcing me to eat the food," and yet their weight was stable over a period of time. So I do think there's a possibility. And then I think a second reason why I believe that it's not, I think it's reasonable to eat, but that it's not likely to actually induce weight loss. I tend to think along the lines of that macronutrient profile is not as critical to weight loss. I think when you look at individual studies like the Pounds Loss study done by Frank Sachs, and when you look at meta-analyses that aggregate data across high carb versus high fat versus high protein, you don't really see much difference in terms of average weight loss at 6 months and then 2 years. So I'm not a big proponent of altered macronutrient profile as a means to lose weight. So I think the DASH diet should be an adjunct, but is probably not the driver. I think the big driver is reduced calorie consumption or calorie deficit. Is that okay? Great. Thank you.
Thank you.
Thank you. I choose not to do rodent studies. I'm very honored to be here, and thank you, Keith, for inviting me to. Keith has challenged me to talk to you about phytochemicals, so I'm going to talk about not the last century, but the last quarter century, which is how long I've been here. and talk about a little bit about phytochemicals in general, because I think it hasn't been touched on. A couple of definitions for you, and then talk about our work, highlighting about, I think, 3 of our studies over the years. So, what are phytochemicals? Phytochemicals are the things that make fruits and vegetables green and purple and make them smell good or smell bad, and so on and so forth. They are a little bit more formal definition, I suppose, is that they are non-nutritive. In other words, they're not required for your survival. We just heard, for your survival, carbohydrates and proteins and fats are required, and certainly you get them from fruits and vegetables. But these other compounds that we call phytochemicals are what are also known as secondary metabolites. They help the plant protect itself from predation, by and large, make it more attractive to pollination, and so on and so forth. They're low molecular weight compounds, and it turns out they have some pretty significant and substantial health benefits for people. Why do we care about them? Well, as you've just heard, actually this Dr. Apple's talk was a great lead-in to this one, I think. As you've just heard, phytochemicals are present in most people's diets, and all of us eat them, and we eat them all the time, and we eat them for all of our lives, either a lot or a little. And they are of low toxicity, so they're a vehicle. They're present in spices, of course. It's not just fruits and vegetables. They're present in spices. They're present in traditional Chinese medicines and Ayurvedic medicine, and on and on and on. And so compounds can be extracted and isolated and purified, or again, they can just be eaten in their native form in fruits and vegetables. And I should say that we in the Cullman Chemoprotection Center over at the School of Medicine view it as our responsibility, our charge, if you will, to put teeth into some of the dietary recommendations. And we've done that really by looking at a very small number of compounds from fruits and vegetables, but to give some evidence for why they may be helpful in specific instances. So they present opportunities for disease prevention and therapy. You're familiar with many of them by name: tocopherols, carotenoids, et cetera, et cetera. And as I said, the biological activities for many of them have been very well substantiated by this point. I should mention, and I have to be careful how I say this, I suppose, in this audience. I have to be careful I don't offend too many physicians, but diets rich in phytochemicals are frequently overlooked in favor of drugs. And you can argue about whether this is good, bad, or ugly. But we can ask whose fault it is, and we can also ask how to fix it. I think many would agree at this school even, that clinician discomfort or lack of familiarity with what some of these phytochemicals do, and with some of the foods and ways to deliver the foods, is perhaps in part to blame. Certainly there's concern over phytochemical drug interactions, and that's understandable. But it's no different from drug-drug interactions, which have to be dealt with. Knowledge is power, right? So speaking of drugs, I should just remind you that some of these phytochemicals have been pulled from their plants and turned into drugs, and there's nothing wrong with that. This is Dr. Yu Tu, and she 3 years ago won the Nobel Prize in Physiology or Medicine for her discovery of the antimalarial properties of artemisinin and discovery of artemisinin, actually. From wormwood. Wormwood comes from Qinghao, traditional Chinese medicine, but it's not just a medicine. Wormwood is also used, the leaves, as a salad green in parts of Asia, as a condiment, and related species are used to flavor absinthe and vermouth and bitters. So this stuff is a food, and it's also a drug. And I should also mention that a collaborator from the medical school and close collaborator of ours, Terry Shapiro and Gary Posner, who's now deceased, have sort of carried this work forward and made multiple additional generations of artemisinin and extracts that are highly effective in malaria control. And many of them are being tested now. So other than their use, their interest in drugs, how do they lend themselves to use? Well, I think we've talked about this. There are two obvious ways. One is as a component of foods. The other is in nutritional or dietary supplements. And you've all seen them. There are hundreds, there are thousands of them on the market as dietary supplements with very questionable claims for some, and perhaps good claims or useful claims for others. And we'll come back to dietary supplements in a minute. But in this audience, I should remind you that the epidemiology is strong, is very strong. Again, you've just heard some of the recent work, or some of the work over the last 20 years from Dr. Apple. But that diets high in fruits and vegetable consumption do reduce a variety of chronic diseases and may hopefully improve health span. To layer on top of that, we over the years, and Paul Talalay, one of my mentors over the years, about a quarter century ago, introduced this concept that a variety of edible plants contain inducers, phytochemicals, inducers of the cytoprotective enzyme systems in our bodies. And they upregulate not only some of these cytoprotective enzymes, but antioxidant enzymes, which may be one and the same. They inhibit inflammation, many of them, and they have a whole host of other effects. And this is just one class of phytochemicals we've been looking at. There are many classes, obviously. So there's a huge array of activities, probably as long as any metabolic chart you pick. There are that many potential activities of phytochemicals. We've used the term green chemoprotection just to connote this dietary delivery. But I think the point I'd like to emphasize here is that, yes, it's effective in a context like the rich Westerners in this room, but it's also effective, we think, in the developing world and in regions where people can't afford other interventions. If one can be effective and learn lessons from some of the previous speakers and change the dietary patterns just ever so slightly in some of these regions, we may be successful in changing certain chronic disease profiles. So the compound we've worked with is called sulforaphane. We've spent really I've spent the last quarter century immersed in it. It's an isothiocyanate, that's the chemical class. This is all the chemical structure. This is the only chemical structure I'll give you. But the isothiocyanate is this piece of the molecule, and then the left-hand side can be one of hundreds of different structures that regulate the way the compound works. Paul Talalay, again, the gentleman who hired me here and who started our center, and Yushin Zhang, about 28 years ago, discovered sulforaphane in broccoli, discovered that it was a very potent inducer of protective enzymes. Gary Posner, who, as I say, is recently deceased, he was a beloved teacher and chemist at the Homewood campus. He developed hundreds, or at least certainly well over 100 analogs of this molecule. None of them were as active as the natural compound, which we stuck with then. And I came along in 1993 and discovered that actually the precursor of sulforaphane, which is called glucoraphanin, was present in very high levels in broccoli sprouts. And we've used broccoli sprouts, and I'll tell you about three sets of studies. We've used them to demonstrate the power of this molecule over the years. I should just also mention Terry Shapiro, who I mentioned, a malaria expert at School of Medicine, then helped us get a number of our small clinical trials off the ground. So we developed broccoli sprouts as a dietary source of protective phytochemicals. We've also tried very hard to get funding and to get work going with moringa, which is now being touted as a superfood. This is a leafy vegetable that grows in the tropics and has many of the very same kinds of compounds, and we think the same kind of protective effect. One can eat the pods and the seeds and the leaves and so on. This is actually a former MPH student, Belinda Chu, who's standing by one of our plots in Mexico. with a moringa tree. And these are, I think, actually growing in my window ledge in the Rangos building. You can actually grow the plant as a leafy green, tender young vegetable. So most of our work has been with broccoli. Over the last quarter century, this compound has been developed, and delivery modes have been developed. But I have to say that without extensive work by a large group, all of them having appointments, joint or otherwise, here at this school, I think I wouldn't be standing here talking to you about it today if the development of an understanding, the discovery of and the development of an understanding of this major regulatory pathway that this molecule locks into wouldn't have happened. So one of them is sitting in this room here, John Groupman, and Masa Yamamoto from Tsukuba and now from Sendai, Japan, certainly was instrumental in getting things started. He has a joint appointment here. So now that we understand only part of the mechanism by which this molecule works, we know that this very central signaling mechanism is important in the development, the pathophysiology of a number of important chronic diseases. Thus, we have done small clinical trials looking at not just one, but a number of separate conditions. I've whited them out just to eliminate confusion and speed us up. There are many that we have been involved with. I'm going to talk about just 3 of them here in the last couple of minutes that I have. Small trials, just to give you a flavor for what we've been doing. All of this is published, and all of it still remains pretty exciting, I think. Bioavailability. I mentioned we discovered the precursor in broccoli sprouts, the precursor called glucoraphanin. It's not very bioavailable, and this is 100% bioavailability as measured by a day's worth of urine collection in clinical trials. Each dot is a day's data, so something like 10% bioavailable. If you give sulforaphane, the active molecule, the bioavailability is quite high. And then we thought we were so smart, we thought we would eliminate some of this person-to-person variability by giving the enzyme which causes the conversion simultaneously. And we didn't eliminate variability. There's still tremendous variability person to person, but we did sort of split the difference in terms of bioavailability. We made it more bioavailable. I should point out this enzyme is present in your gut microflora as well as in the vegetables that contain the compounds. The unfortunate thing is that we did, my group, our lab, made all of these powders, and these powders took half of our time eventually to make and document and do the quality assurance on. And it was keeping us from doing the more exciting business that we're here for. And so eventually, about 3 years ago, after being very antagonistic to dietary supplements for many years, I turned to the industry and said, help. And they actually did help. And they were, there are, as I say, hundreds of these supplements, but these folks have learned how to stabilize the powders and to deliver these extracts. So we went to them with the idea that for clinical trials, I'm not advocating daily consumption of these by the whole world, certainly, but for clinical studies, this is a very effective way to do our work. And so, as I say, they came forward. Out of hundreds of them, we've identified a very small number that have what they say they have in the product information, so that deliver what they promise. And the give for the get here was that they also, in addition to supplying our clinical studies, they had to give us all the documentation for our IRBs and for the FDA if we filed for INDs. And they've been very gracious in doing that for, I think, obvious reasons. So, yeah, we've talked about this. So the second set of studies, very briefly, John Groupman, who'll be talking to you later. John, I hope I haven't stolen your thunder and you weren't going to talk about this, but John was certainly a key part, a principal investigator of some of these studies, as were many other people in this school. And we looked at detoxification of aflatoxin and air pollution. And this is a fascinating story that John and Tom Kensler and others have spun over the years. Most of you probably know it. If you're students, you'll hear it this year. But aflatoxin is produced, it contaminates corn and peanuts. We went to a subsistence farming area in rural China where they kept their crops from year to year. This potent liver carcinogen was present, and 1 in 10 people in this area near Shanghai died every year of liver cancer back then, 25, 30 years ago. Over the years, that problem has gotten much better because of globalization of the food supply. They're exporting their contaminated grain out of the area. And as you know, air pollution has gotten much worse all over China. And this actually is probably a picture of Pittsburgh air pollution, not China, but I think it makes the point. Sorry, just to go back. So they, Kensler, Groupman, et cetera, that whole group started out looking at some synthetic preventives, and we joined forces with them in the early 2000s for a number of studies on broccoli extracts. And again, just to drive the point home, it's a picture of Tom Kensler getting the National Friendship Award in China, and he's kind enough to share it with many of the people on the team. And you'll see someone from this school in, I think, every row on this picture. So it was a huge team effort. Just one of the trials, we had to grow a lot of broccoli sprouts, boil them up, extract them, aliquot them, dose them. We dosed them as a tea, fairly foul tasting according to some people. We got wise as time went on and used various juices as masking agents, which also enabled us to make better placebos, to create decent placebos. And then the give for the get here was a lot of urine. So this is one day's urine from a 200-person study. And so nobody who went to China to work on this study escaped having to aliquot urines. And I should say then that Pat Egner, who I don't think is in the room, had a massive effort doing all the mass spectroscopy for the analyses. But again, this is just one of many studies that were done over there. But for example, 2 very common air pollutants at that time were detoxified. There were more conjugates of these detoxification products of these air pollutants came out in the urine of subjects that were taking the broccoli sprout beverage than those that were on placebo. And it paralleled the air pollution levels. Keith's giving me the hook. The last set of studies I wanted to share with you, and I'll skim over them very fast, is autism. Totally different condition, totally different. But as you may be aware, antioxidant status, oxidation status, I should say, in the cells, detoxification, heat shock response, all of these things are connected mechanistically to the NRF2 pathway. We thought it might work. Our colleagues at Harvard came to us and said, let's try a clinical study. We did 18 weeks, and those on sulforaphane, a broccoli sprout extract, had improvement in common markers of aberrant behavior, which went back to plus or minus close to baseline a month after the intervention was stopped. I should mention in closing, there are 5 follow-up interventions now. Our colleague Andy Zimmerman we're working with him, I should say, on a direct follow-up of the study I just showed you that was published. Biomarkers are being worked on by Hua Lu in the back of the room. We're doing all the biomark work, which was not done in the first study. Andy will be presenting next week a very positive report at a meeting in Chicago, national meeting, saying that there were dramatic improvements in behavior in those on intervention. These have all been done with supplements. And one other study's been published. There were positive effects. 3 others are in progress. If there's time for question, Keith, you're back to our MC. My closing slide just is to ask you who the heck pays for these studies going forward? Is it the food industry, the pharma industry, the supplement industry? And that's what I'd love to talk about, but thank you.
We are going to abandon that break, and these talks are so refreshing unto themselves. Vegetables, broccoli sprouts, that I'm going to ask you to stretch in your seat, and if you have a question for Jed, you can ask it right now, and we will get the other talks going. So Jed, you're on the hot seat for at least one.
So I'm responsible for you not getting a bathroom break. I'm so sorry.
I think Dr. Summers is going to
I'm going to be back.
Any questions?
So, we're getting the next slides ready. We're used to talking about deficiencies, preventing deficiencies. And increasingly for nutrients, we're talking about health span. We're talking about these phytochemicals promoting health when they are above a certain level, even though they're not essential for life. Would you like to comment on that trend? I mean, we see that in the phytochemicals. We're seeing it in some of the nutrients. We're developing an idea that there are thresholds for intake above which there is health without the usual caloric, fat, sugar excess.
Yeah. Keith, I'm sort of distressed that you had to ask me that question because it makes me have to say something that sounds very favorable to the dietary supplement industry, and I don't like to be put in that position. But I was talking about this with Kelly Brownell last night, actually. As we age, and those of us of a certain age realize that we get less physical activity and can eat less, and we do eat less. And as we eat less, can we get 9 servings a day of fruits and vegetables? Well, I self-examine, and a lot of times, no, I don't, even though that's my goal. So, I mean, I think that as the population ages, as people age, there may be good cause to supplement with some phytochemicals that can most easily be gotten as concentrates, whether it's, omega-3s, fish oil, but whether it's plant-based omega-3s or whether it's, sulforaphane or whether it's flavonoids or anthocyanins or other compounds that come from plants. So, I mean, I feel bad, in some ways I feel bad saying that because my shtick for many years has been you should eat a healthy diet rich in fruits, a varied diet rich, I sound like Michael Pollan. You should eat a good diet, period, go away, But we don't all do that, and a lot of us can't do that. And I think the supplements are getting more sophisticated, certainly. But obviously, the other end of that spectrum, the danger in my mind is that you'll eat 5 bottles of Soylent protein mix a day and take a bowl full of supplements, and I don't like that perspective either.
Thank you. Thank you. Thank you very much. When you said Soylent, I'm glad you didn't say Soylent Green. So I think that's an area that we'll get into more. You've brought in the notion of healthy food supplies and how do we balance diet with what the planet grows and what we produce, and how do we reach those balances? And some of that is going to be covered in this next session. So I'm going to introduce again our 3 speakers. And then save the last speaker for Dr. Grootman, who's going to wax on how all of this looks going forward as we bring biology into public health. So we'll have Dr. Rebecca Heidkamp bringing focus to preventing nutritional deficiencies by the numbers in countries that need the numbers. Tackling micronutrient deficiencies through partnership, bringing in some of that power from Dean McKenzie. And then Jillian Fry talking about fishing and farming our waters, whether we have to really scrape the bottoms of our rivers and streams and oceans dry in order to eat the fish that we need, that we think we need for diets. So, and then we're going to have Dr. Grootman reflect on how biology and the environment come together and how we look forward to the future. Thank you. So Rebecca, please. Thank you.
Thank you, Keith. So I'm definitely going to shift the focus. I'm also grateful that Jed shifted the rat because his nemesis lives in my Baltimore backyard, and it's my nemesis, so I'm glad not to have that. But I'm just really grateful for this opportunity to talk about something that's maybe a little bit different from a lot of the research that we've been talking about so far. But that, we live in an increasingly goal-driven era. And I think we really do credit the Millennium Development Goals, which brought us from 1990 to 2015, with really kind of shifting our culture around accountability, giving some more focus to especially the development agenda in low and middle income countries. And we've actually moved into what we call the sustainable development era, where the numbers, literally, of goals have increased. And particularly important to the food and nutrition community, we have a goal, number 2, unto ourselves, and quite a number of sub-goals. And somewhere in there, as a community, maybe even more direct to the nutrition community, the World Health Assembly in 2012 passed the World Health Assembly targets, setting global goals around stunting, wasting, low birth weight, anemia, obesity, as well as breastfeeding. And really uniquely, they were truly global goals, like the Sustainable Development Goals are. And now these have become part of and getting extended to be part of the Sustainable Development Goals. So we're increasingly goal-driven, but we're also just increasing in numbers. We talk over and over, especially at the School of Public Health, about our growth in population. And as we look ahead, we see that populations are going to continue to grow, especially in Asia and Africa, in some of the parts of the world that we see as being very nutritionally vulnerable. So information is everywhere. We have incredible new technologies to help us capture, to analyze, to disseminate data. Big data has actually become trendy in many ways. But just like we talk about inequities in healthcare, inequities in access to services, inequities in education, we can also talk about inequities in information. So information access is not equitable, and like the UN, the Independent Expert Advisory Group for a Data Revolution for Sustainable Development pointed out in their 2014 report, is that some people are living this reality of the data revolution and of big data, but many people, organizations, and governments are excluded from this access to data because of lack of resources, knowledge, capacity, or opportunity. So there's a huge and growing inequalities in our access to data and information and in our ability to use it. And the inaugural Global Nutrition Report in 2014, probably not coincidentally, really picked up on these themes within the nutrition sector, calling for nutrition to have a data revolution, and that we need to fill the data gaps that are actually preventing us from taking action and impeding accountability. And they actually named out some areas in terms of our progress towards those World Health Assembly targets, but also finances, food consumption, programmatic costs, low birth weight, capacity to scale up interventions and have impact. Now we've made some progress in terms of global nutrition reports. The next one actually will be coming out in a couple months. But in 2017, I think we see something that's actually quite humbling. So this is looking across the different goals and looking at whether or not countries, so there's 193 countries included in the Global Nutrition Report. It's truly a global effort. And looking at whether or not they're making progress on stunting, wasting, overweight, breastfeeding, anemia, obesity in adults, and diabetes in men and women, which is an NCD goal. Red meant no progress or worsening. Yellow meant some progress. The lightest is on course. So, of course, we have relatively few countries on course. But what I want to point out is actually the gray, which is saying no data or insufficient data to actually track progress. So these are countries that don't have, 2 data points since 2012 to actually say what is our progress towards these goals. So here in stunting, we have 142 out of 190 countries that don't have 2 data points. The data that we do have shows that globally, and we really have had this focus on global data, we are seeing some progress on stunting. We continue to see high levels of wasting, and we are continuing to see, as expected, increases in overweight. But these global numbers, where a lot of the attention has been, are not necessarily what our highest burden countries need in order to make their decisions for their own contexts. So if we think about Nigeria, which has the highest number of stunted children and one of the highest prevalences of stunting in the world, we've got India, which has complex, multiple nutritional problems, particularly though in the area of wasting. The burden of wasting is much higher than it is in other regions. And then we think of the United States as a country with a very high burden and large numbers of overweight in our population. So what numbers do countries need in order to be able to advance and solve their own problems? So they need to know what the nutritional problems are and what their causes are. And I think this is data on nutritional status, on poverty, food security, on the knowledge, the practices, what's happening in the populations themselves. They need to know where and among whom they have those problems in terms of geographically, that can vary quite a bit, but also in terms of equity, socioeconomically, educationally, who is the most vulnerable. How much will these problems cost to address? The need for financial information over and over comes up in terms of making policy decisions. So both in terms of what does it cost if they choose certain approaches, but also what other resources in terms of human resources capacity are needed to reach those. Ultimately, as they start to roll things out, they need to know who are they reaching with the different interventions, so intervention coverage. They also need to know where and how we can implement better. So a whole issue about how do we strengthen our delivery mechanisms, are our supplies chains working, do we have quality? And then ultimately they want to know, are we having an impact? And that's really covering all of these areas. And I think we really can't kind of overemphasize that the single nutritional problem. So we have a goal for anemia and anemia reduction, but the causes of anemia and the risks and what that looks like in a particular context can actually be very different. So just because we have a global number doesn't mean we have a single problem. And we do need the data that enables countries to know what their problems are, where they are, and therefore to be able to track the solutions. So where do particularly low and middle income countries get their data? It's just the context that I'm most familiar with. There's quite a number of platforms that consistently contribute to information systems in countries for nutrition and other areas. Household surveys, facilities, schools, other sorts of institutional assessments, administrative data, so the health management information system. There's also agriculture information systems, educational information systems, all sorts of kinds of surveillance systems. We often think in nutrition of early warning systems for emergencies. Civil registration and vital statistics is an area that's actually getting a lot of attention that we don't think about as much in nutrition, but is an important component, as well as research. Countries can learn about their situation from research. So where is it, though, that the nutrition community, as we look at these different sources of data, are going to get their information? And as part of an initiative that I'll talk about a little bit more, our team here at Hopkins, working on the Data Dent initiative, just a couple months ago, in preparation for a consultation I'll tell you more about as well, did an online survey of the nutrition community. So we reached out through networks, through listservs. We used the UNICEF and their different country offices and got a pretty decent response. But we were basically asking people, where is it that in the last year that you've gone to get your data? So looking at this long list, I can point out that, about a third of the respondents were going to those administrative data systems. But the vast majority were citing household surveys. These household surveys as being a major source of where they go to get their data on nutrition. And one of them stood out above all of them in terms of the demographic and health surveys. So about 3/4 of individuals had access data from a demographic and health survey in the last year. So even though all of these could be developed into a story that's worth telling, I'm really going to focus in and talk more about household surveys, because that's actually where we at Hopkins have done most of our work in DELT measurement. And I'm going to talk specifically about the DHS program, just to give us a little bit of focus. So I think many of you are familiar with DHS data, but it's a survey program that was started in the 80s, originally focused more around reproductive health. It's been funded consistently by USAID as well as other partners, depending on the countries where they are. But now they actually are doing more than 300 surveys across 90 countries. ICF, an institution, a nonprofit in DC, and other partners are technical assistance providers. So the data are actually collected by local bureaus of statistics or institutes of public health or other institutions in countries. But then the DHS program comes alongside them and provides us quite a high level of technical assistance. In general, countries have surveys about every 3 to 5 years. There's other survey programs that come in between or sometimes take the place of a DHS. But one thing that's really interesting is that the DHS program has used the same core questionnaire, and as much as possible has tried to keep the same core questionnaire across time and across context, because a big issue is data comparability. They want to be able to track progress over time. These are huge surveys, very comprehensive. They ask questions on the households, on women of reproductive age, men, and particularly a focus on children under 5. The interviews can last more than 6 hours, which is not something to underestimate. Sometimes they actually have to go back a second day. And the core questionnaire, and currently we're on core questionnaire version 7, does include some nutrition data. It's relatively limited, but some of it's really important. So they collect data on anthropometry, especially the height and weight of women and children, and sometimes others in the household. Child feeding practices, so practices around breastfeeding, also complementary feeding of older children, the food groups, whether they meet certain dietary levels of acceptability, as well as certain interventions, which I'll talk about more. There's 2 big issues when we think about the DHS that we often don't talk about, but they are actually really important to think about. First is, are the data that we need in the core survey, given how important this core survey is, and some questions about data quality. I think there is a little bit of an assumption. It's funny, I've talked to people at the Bureau of Statistics in Tanzania, and they say, these are truth. These are the true values, and this will actually come back around. So are these data really of as good a quality as we need? Another issue that the DHS program actually often becomes the model from which other survey programs take their questions, because they want to be consistent, they want to be able to compare. So what happens in the DHS can actually have a big ripple effect, not just in terms of country data, but in terms of how other people collect their data. So just looking, in order to kind of get a standard, it's really hard to say, so what is our list of nutrition interventions? But if we take the interventions that were recommended in the Lancet 23 Nutrition Survey and compare it to the DHS 7 core questionnaire, and these are interventions that many countries are using as a guide in terms of determining what is it to include, we see that very few are actually included in the core DHS survey. So there's data on salt iodization, on iron folic acid in pregnant women, vitamin A supplementation in children, on zinc, but not preventative zinc, zinc in terms of treatment of diarrhea. And they just in the last cycle asked one question about whether a woman received any breastfeeding counseling in the 2 days after delivery. But there's nothing about complementary feeding, about growth assessment, about treatment of acute malnutrition, which are some of the areas where programs and countries are putting a lot of their resources. So in the absence of intervention coverage data, because we've really relied on the DHS, and the DHS has relatively few interventions, we've been relying often on interventions of practice to kind of give us a proxy. So our assumption is, well, if women are practicing exclusive breastfeeding, or if they're feeding their children a minimum dietary diversity, well, we're going to assume that they've been reached, or that's a pretty good, proxy of what we're doing. But IFPRI, a part of the Alive and Thrive initiative, did some really interesting studies where they were able to actually say who received the intervention across 3 different contexts, Bangladesh, Ethiopia, and Vietnam. And so here they were looking at those where they know they received counseling on complementary feeding, and the outcome of minimum dietary diversity. And what you see is the relationships are all over the place. We really can't say that these practices are a good proxy as we hope they be. Can talk about, so countries actually have some freedom to add questions or to modify, and we actually can look to India as one of our best case scenarios in terms of having nutrition-oriented intervention coverage data in their DHS survey. So I've highlighted in blue some of the interventions that were added because of a special module around their preschool program that's throughout the Angawadi program throughout India. So they actually were able to look at coverage of food supplementation during pregnancy, health education during pregnancy, food supplementation during lactation, growth monitoring and screening, which is really key data. And excitingly, they actually have this data at district level. The challenge is there's some very key interventions like food fortification, therapeutic treating acute malnutrition, where there are no data available. And another interesting point is that it had actually been 10 years between DHS surveys. So we got an amazing amount of data in 2015, but the last survey had been almost 10 years before then. So in terms of how is it that we can start asking about or expanding our availability of coverage data for interventions? So Hopkins has actually really been an innovator in this arena just in the last couple years through the PMA 2020 program, which is a family planning program that out of the Gates Institute for Reproductive Health, where they have annual surveys using resident enumerators around family planning and reproductive health. But in the last 2 years, we were able to be part of a team that piloted a new nutrition module that gave us nationally representative data from Kenya and Burkina Faso on quite a number of things like nutrition counseling, unhealthy diets, food security, food fortification. The data was received just policymakers were thrilled to have this kind of much broader view of their data. But another exciting thing is that it actually gave us some examples of how these things could be measured at scale. To actually be able to pilot something in a nationally representative sample is very rare. So we also have to think a little bit about quality. And here I'm just pulling, this is actually something that the DHS program did themselves, looking at quality of height measurement in DHS surveys over time. And I know this is quite small, but I'm going to point out to you. So this is looking at the standard deviations for children who are either below 2 years, which are the blue, because they're measured laying down, versus the orange, children above 2 years, because they're measured standing up. So these are slightly different. So in terms of, and we're looking, these are countries, DHS countries, Peru back here, Benin here. And in terms of quality data, we would expect these standard deviations to be right around 1, okay? But we're actually seeing our spread of data is quite broader. So looking at Peru is kind of what we see as a high quality expectation, but looking here at Benin, we're seeing a much broader spread, which I saw roughly translated could actually relate to about a 3 to 5 percentage points difference in the prevalence of stunting in the country, which is really meaningful. So just thinking about, are there ways that we can measure kids better? There's new guidance from the WHO and UNICEF. There are new technologies that are finally being rolled out. So there is some hope that there's room to improvement. Another area where we've actually focused a lot on improvement of the coverage measurement here at Hopkins is through the Improving Coverage Measurement Initiative, which is led by PI Melinda Munoz. And it's a consortium of multiple investigators around the world who are actually taking these questions that we've asked in the DHS and validating them, asking women, observing a certain receipt of an intervention, coming back after a period of time and seeing could women actually recall correctly. And it's a bit discouraging in terms of some of our measures that we really rely on, we realize have very low specificity. And in the next year, Joanne Katz is going to be leading a study around iron folic acid supplementation and validation of receipt of iron folic acid supplementation. And IFPRI is going to lead a study around nutrition counseling. So most recently, we've been able to actually do some technically rooted advocacy. So trying to take what we're learning and through the Data Done initiative, which is being led by Hopkins along with IFPRI and Results for Development and funded by the Gates Foundation, have some really exciting opportunities to try to do, and I'd like to think, strategic research to influence the measurement agenda and find avenues for disseminating this. So just a few weeks ago, we held a large consultation that we organized as a team from Hopkins with representatives from the survey programs, with technical experts, with individuals from countries, really trying to rally around the next time that the DHS survey or household surveys are being revised, that there can be some common asks or moving towards kind of having some common quality. Just to touch very lightly on data use. So our aim should not just be to prevent information, but we actually need to support data use. But we don't, and we've seen a real large proliferation in terms of all sorts of initiatives that are trying to get dashboards and other ways of disseminating data out there. The challenge is that many of these are using the same data, and we often are kind of getting stuck that we have a limited number of data. We also have low literacy among decision makers. So we did a study as part of the National Evaluation Platform led by Tricia Ong and a team in Tanzania that was really showing that even as we work to develop these very kind of more advanced data visualizations, this is kind of the state-of-the-art way for presenting equity data, over and over again, policymakers wanted their bar graphs because that's what they were comfortable with, even though they couldn't interpret them. We also have issues in terms of capacities for data collection and data analysis. We also have concerns that data are power. So just last week, I don't know how many of you saw that the National Tanzania presented a law that if anybody quoted unofficial statistics, it could result in a fine and jail time up to 3 years. So statistics are big deals. So ultimately, and I think we could have touched on any of these things, we're making slow but real progress in terms of strengthening our data valuation chain for nutrition, all the way from what we prioritize to collect, how we can collect it, how we put it and display it, analyze it, and ultimately lead to decisions. But this is an area with vast opportunities for research, innovation, advocacy, and capacity building. Thank you.
That's the timer. Let's start the timer first. Good afternoon. It's a great pleasure and honor to be here. My name is Klaus Kramer. I think it was somewhat forgotten in the introduction and was just alerted to introduce myself. I'm with Sight and Life in Switzerland, and I'm also adjunct faculty at the School of Public Health. I'm thrilled to be here, and I'm grateful to Dr. Keith West for the invitation. I will be speaking today about partnerships and how partnerships, and this is a very special partnership, can contribute to public health nutrition. Where is it? This is a brief outline. It looks as more as it is. The first is just one slide. And this one slide I will start with. We talked just about data. And when we talk about micronutrients, then there's a real dearth of data. And in the forthcoming Global Nutrition Report, there will be, for the first time, some mentioning of micronutrients and the problems that we face in the lack of data in micronutrient intakes and micronutrient status. And we did, in collaboration with the School of Public Health a few years back, a global mapping exercise of micronutrient deficiencies or hidden hunger. And Dr. Robert Black was part of the team, really grateful to his insights. But it also showed that we have significant limitations. We used stunting as a proxy for zinc deficiency, as suggested by iZinc. We used anemia as a proxy for iron deficiency. There are huge problems with the data set we have on hand, and particularly these are national data collected on the WHO database. We also need to look into the districts, sub-districts, and provinces, and even in the communities. The situation may be very different from community to community. I was thrilled yesterday when I came into the building and seeing a flyer about the new strategy of the school that was announced by Dean Mackenzie. And it has 5 different pillars, the pillars of education, science, partnership, people, and advocacy. And I thought, this is part of our partnership between the company DSM, Johns Hopkins School of Public Health, and Sight and Life. Sight and Life is my organization. It's a Swiss-based nutrition think tank, receiving, and this is my disclosure, the majority of its core funding from the company DSM. And we aim to be a sounding board and honest broker between the public and the private sector in order to improve nutrition in low and middle income countries. And we have also, in addition to the partnership with the School of Public Health, partnerships also with UN agencies, academic institutions, and the NGO sector that are also contributing in the broader nutrition ecosystem. And particularly, we have been working in the field of research and technical assistance to research over the last, almost 40 years. I will touch upon Chivita land, and I think everyone in the room is familiar with Chivita in the rural northern part of Bangladesh. And in that area, we face a significant lack of dietary diversity. And in these slides, it's nicely shown that with increasing household food insecurity, the consumption of animal source food particularly is declining. So we are lacking, with a certain certainty, micronutrients in the diet of these people. And I would like to talk today just about Chivita 3, which is a huge undertaking that was published in 2014 using multiple micronutrients in pregnancy. Chivita started, as we heard earlier today, in 2000, and so far there have been 4 trials completed on maternal vitamin A supplementation, on newborn vitamin A dosing, on multiple micronutrients in pregnancy with Chivita 3. Chivita 4 is a complementary feeding trial that was completed a few years back, and there are now 2 trials in the preparation and are commencing shortly. This was the paper in JAMA published with Dr. Keith West as the first author, and it was a randomized controlled and placebo-controlled study in the northern part of Bangladesh with Bill and Melinda Gates funding. It started in about 2006 during a visit in Bangladesh, when I had the chance to purchase a few micronutrient supplements from the Bangladeshi market in the pharmacy. It's quite a developed supplement market in Bangladesh, what we would be wondering about. There were 5 samples I took back to Switzerland for analysis at DSM, and we found there was just 1 brand that did meet the label claims. Based on this observation, we approached the company Bexico in Dhaka and requesting the local manufacture of an imported vitamin and mineral premix. And the company was so nice, I have to say. They immediately agreed and they produced all the 16 million supplements for the Chivita trial and delivered it to Gaibandha for the distribution. This was a formulation, the typical one. It's called the Unimap formulation, which has been now used in almost 20 trials over the course of 20 years. And these have all been done in pregnant women, starting usually when the pregnancy was diagnosed. And we have quite a significant body of evidence that multiple micronutrients compared to iron folic acid only are superior in the reduction of low birth weight, small for gestational age. But the situation that we face is that the deficiency in these populations may be quite significant. This is a slide that shows the deficiencies in the first trimester in the Civita-3 trial. I could also show another slide from Dr. Carrie Schulze in the third trimester. The deficiency doesn't go fully away with the supplementation of 1 RDA daily during pregnancy. There's a remark on vitamin E, but this is another story. It relates to an observation from Civita land in 2 trials that vitamin A, specifically alpha-tocopherol deficiency, increased the risk of miscarriage in the women. Civita-3 had remarkable outcomes in reducing a number of risks in the population. There was an improvement in gestational age at birth, weight, length, MUAC, chest circumference, and head circumference, all statistically significant in this massive trial. But the situation we face today is we don't have yet a policy that has been adopted by the WHO for making a strong recommendation for multiple micronutrient pregnancy. What I learned earlier today, we may not have the right change agents involved so far to make this policy change happen, because we have 20 years of research, 20 large-scale trials, and we have a number of meta-analyses that all came to the same conclusion. Low birth weight is reduced compared to iron folic acid, and also small for gestation age. And for the WHO, we have now for 50 years no policy change. It's just iron and folic acid. And we all know the poor coverage that happens. And in these countries, we still expect an effect from iron folic acid supplementation, but the effect would be more massive if we would start replacing iron folic acid by multiple micronutrients. This is one of the meta-analyses using 15 of the trials, but there was a reduction of 12% of low birth weight as one of the examples. The WHO had a consultation in their guideline development group, and there was the report published in 2016, and there's no recommendation for multiple micronutrients. There was a concern about safety of a multiple micronutrient compared to iron folic acid only, but they opened an option for countries that have experienced significant micronutrient deficiencies to use a multiple micronutrient and not an iron folic acid. So we see quite frequently deficiencies. In Civita, it is very obvious. And what we really should encourage also as an advocacy, joint advocacy, countries to build their own conclusion and not always relying on the WHO. They have to take care of their own population and not waiting until WHO makes a contribution globally. And in addition to that, we also need a recommendation and guideline for regions. One example is the newborn vitamin A dosing. I don't want to further go into details, but I think there's a need that we also follow these scientists who have done massive meta-analysis, and the most recent was published on individual data by Smith in the Lancet Global Health end of last year, and there were quite a number of contributors here from this room, and they now can confirm that there is no safety concern of the multiple micronutrient compared to iron folic acid, and even it gives an advantage of the females having a lower mortality with the multiple micronutrients. Now I would briefly stress a few more recent developments, and I like this quote from Lichtenberg in the last quarter of the 18th century. Science is on the move, and we have to build evidence on a continuous manner, and we are moving now into a new area with the omics technology, and Dr. Keith West has had the vision of using proteomics to develop a rapid assessment methodology for micronutrient status, and I think this has made enormous progress over the last years with more sophisticated technology using mass spec instead of the electrophoresis. These are just two examples aiming to explain the micronutrient levels in blood by proteins for vitamin A and vitamin D in one paper, and the other one copper and selenium. It is possible. It still needs hard work. It needs hard thinking and mathematics to develop this methodology and identify the right biomarkers. And we think this is the way certainly to go, using omics technology for further advancing nutrition. We were just alerted to stunting. Stunting is a target of SDG 2, but we also see a number of countries that are now getting cold feet because the stunting reduction is not that fast as they would like to see and have promised to achieve. And we have started a new initiative, we call it Nutrition Arise, where we aim to establish validated additional markers that are responsive to early child nutrition interventions, in addition to stunting. For instance, cognition could be one of those if we have the validated methodology to assess it more rapidly. And we had the first consultation together, organized between the School of Public Health and Sight and Life during the nutrition conference in Boston earlier this year. We have, and this was hatched at the Great Wall in Beijing between Keith and me, an internship program over the last 12 years between the school and Sight and Life. And these are our interns that came either to Switzerland or working in a field setting, doing their practicum for their capstone. And we also supported through the DSM Sight and Life partnership that was renewed in 2014, a number of young faculty. I think Dr. Amanda Palmer was one of the first receiving a grant, and a number of scholars were given to PhD students. Just two examples of this brilliant, smart young scientist is Dr. Musi Na, who is now at Penn State. And she was also the first winner of our elevator pitch contest on nutrition in Cancun at the Micronutrient Forum 2 years ago. And there was a second finalist who was invited to Cancun, Seran He, also a student and a intern with Sight and Life. The other one is in the room here. It's Sunny Lee, and she has done a tremendous work in the proteomics and omics field and prepared a seminal paper for Sight and Life magazine on the omics technologies. And I really thought this is one of the best papers I've ever read on this topic. And it is certainly important that we also translate the science so that it can be adopted by others. And to mention, Sunny was an emerging leader named at the ASN conference and will be the winner of the Rainer Gross Award to be presented at the SLAN conference next month in Mexico. And finally, we have produced during the last couple of weeks a publication on this partnership. It's more like a case study, and I'm really grateful to two people specifically here in the room, Dr. Alfred Sommer, who was instrumental in forming Sight and Life in the mid-1980s. It coincided the groundbreaking research on vitamin A supplementation and child mortality with the famine in the Horn of Africa. And at that time, the company Hoffmann La Roche that owned Sight and Life before DSM and the World Health Organization and Helen Keller International with the School of Public Health built the task force Sight and Life. And then Dr. West also came into the game, doing the groundwork in ACE with the vitamin A supplementation trial. And I think it's a fascinating history and story, that journey that we have worked and walked through over the last decades. And I'm really grateful to be part of this community. Thank you.
Probably time for one question while Jillian.
Do you know of any other partnership between the private sector who have migrated from one company to another company and an academic institution that's lasted as long as this one has?
I'm not aware of any other. And in addition, it is a tripartite partnership in the meantime, since we are an independent legal entity, etc. So it's something in between.
It keeps more effective.
Yeah. So we can use more. Yeah.
Good afternoon. My name is Jillian Fry, and it's such an honor to be included and invited today. My work is at the Center for a Livable Future, based within the Environmental Health and Engineering Department, and we focus on the food system and public health, and a lot of our work has to do with understanding the limits of the planet related to how we eat and how we can shift what we do to meet these nutrition problems and solve them while staying within our planetary boundaries. So I'm going to talk about seafood. And just for context, I'm not focusing on nutrition, but just so we're all on the same page, it's a great source of lean protein. Some forms of seafood are a very good source of marine omega-3 fatty acids, but there is a lot of variation within seafood. Vitamins and minerals are very important in seafood and important for health. It is identified as important for brain and eye health. It is identified as giving protection against heart disease and stroke, a moderate level of consumption. There are contaminants in seafood. Food that we take from the aquatic environment is a really special and close link that we have with our environment. And so most of the contaminants that are in seafood are there because of human activity. That is a special and unfortunate link that is a bit unique to seafood. New data from the CDC tells us that only 20% of American adults meet the 2 times a week recommendation for seafood. And importantly, when we talk about wealthy countries, including the US and the global situation, seafood has a different role in the diet. So in the US in general, the micronutrients are helpful. Recommendations a lot of times are based on omega-3s and the chronic diseases that it helps to prevent. In other areas, especially certain low and middle income countries, it's very important for food security. So this is the current situation. This chart from the FAO shows wild capture global fish stocks in orange and farm seafood or aquaculture in blue. And we see that there is a steady increase. And when we look at the wild caught fish, just the orange part, starting in the 1950s, the production was going up because effort was going up. We had more boats, they were bigger, their gear was bigger. And so the yield went up. And if you think about what we were doing, growing food on land as well, we were going through the Green Revolution about the same time. And yields were going up because of inputs, fertilizers, pesticides, things like that. And the Green Revolution solved a lot of problems in terms of food shortages, and the environmental implications that we still struggle with did not become clear until later. But within fisheries, we had a very clear indication in certain regions and with certain species that as we ramped up our effort, there was not the capacity to keep up the level of production that we were seeing. So one example, famous example, is the collapse of North Atlantic cod. And these are landings from 1850 to 2000, only in Newfoundland. And as you can see, and if the chart went out further, there were sustainable levels of catch for a very long time. And then the boats got bigger, fossil fuels became cheap, and the effort was too large for the population to sustain. And so this was a very important clue to humanity decades before we were really thinking about sustainable food systems, that there was a limit to what we could take from the earth to feed ourselves. Another famous and local example is harvest levels of Chesapeake Bay wild oysters. And so I show you these examples not because they reflect the global situation. We haven't seen crashes like this in terms of the global situation, which is very good for food security. But I show you this because there are things that are not seen when we see an orange line going up for wild caught and flattening out since the 90s. There are patterns and trends within those fisheries that are problematic, that are not clear from that data. And so this is another FAO visual that shows us that the proportion of marine fisheries that are categorized as overfished is steadily but slowly increasing. The maximally sustainably fished fisheries in the ocean are taking over the underfished. And so if we are shifting our fishing patterns to keep the wild-caught species level steady, we see that here there are patterns going on underneath that steady line that should cause us some concern for the future. The examples of crashes in populations that I showed you, fortunately, combined with other examples, led to the development of fisheries management. And so when humans have the ability to go out and catch lots and lots of fish, we need regulations in place and cooperation and enforcement to limit what we catch so that those populations can continue. And this has been very successful in wealthy countries where we have the resources to implement those regulations and enforce them. This has not been the case in low and middle income countries, but efforts are underway to spread fisheries management. So the impact on biodiversity when we take those species goes broader than the target population. And it depends on the gear that we use. I just want to show you two examples where we can see the differences. Here's a bottom trawl visual. And so when you're looking for a target species, this would be for shrimp and other things that live on the bottom. When the trawl goes along, it is catching everything that's on the seafloor. And this is very problematic for biodiversity in the aquatic environment. It also disrupts the food webs in the aquatic environment. We can take something away that's a food source for something else. It could be an endangered species or a food species that we rely on. On the other hand, this is longline, and it's much more specific in terms of the species that they're catching. And there are many other types of fishing gear, but we do know that annually there are massive amounts of what we call bycatch, or the non-target species, that are pulled from the ocean, and some of it is used for human food and some is not. So back to this chart, let's talk about aquaculture. So aquaculture is shown in the blue, and it has been growing steadily, so that combined with wild fisheries, we see an increase in the availability of seafood per capita even as our population has grown. And that's quite an accomplishment. And aquaculture is as diverse as all of agriculture, and I hope I can convince you of that. So I want to show you a few different species that are grown in aquaculture, and we know that in terms of the environmental footprint and potential impacts to the environment, the species and the methods are very diverse, and therefore the issues are also diverse. So here is kelp being grown on a rope. There are no feed inputs required for kelp, and it's a very healthy thing to include in your diet. So very low impact, low resource intensive type of food. Here are some molluscan shellfish being grown, so that includes mussels, oysters, scallops, and they also filter filter nutrients out of the water column. They actually help the environment, and there are no feed inputs, which is important because feed inputs have their own environmental impact and can be grown very far away, but we need to take that into account. And I'll touch on some research that we've done to do that. Here are some crustaceans, some shrimp farms in ponds. They do have feed inputs. And these are freshwater finfish farms. Finfish also typically have feed, they take feed. Some are filter feeders. And these are some marine settings for finfish. So this is the top pictures are net pen production, which is usually done close to the coast. The bottom left is a recirculating facility that's indoors. And the bottom right is a cage used in offshore settings. So it could be miles offshore to grow finfish. And so as I touched on, farming fish, most fish and shrimp, requires feed, and the benefit for sustainability is that they require less feed than other types of animals that we eat. So compared to cattle and hogs especially, they have a lower feed conversion ratio. So they convert feed inputs to body mass more efficiently because they're buoyant in the water, they're cold-blooded, they don't need to regulate their temperature. And so that it has huge potential for the continued growth of aquaculture and the contribution to human food. And I'm going to revisit this fact about the feed relevant to some work that we've done at the center. So like I said, there is significant variability in the potential ecologic and public health implications of aquaculture. So the main concerns would be benthic effects or pollution. So that can be from fish waste, also from uneaten feed. There can be use of antibiotics, parasiticides, and pesticides to control diseases and also pests. And that has important implications for the local environment and also consumers. Marine feed ingredients. So the FCR, the feed conversion ratios, is a sustainability plus for aquaculture. But some species have fish meal and fish oil in their feed that comes mostly from small wild fish. That would be a really healthy, sustainable thing for us to eat ourselves, but humans prefer larger fish, and so those get turned into fish meal and fish oil and used in aquaculture. And so to address that issue, aquaculture has moved toward crop-based ingredients, and that has its own environmental footprint, and it turns out then aquaculture competes with other types of animals that we eat for feed inputs. And that puts stress on our terrestrial agricultural system, and growing demand for feed is a significant driver for deforestation and land use change to grow more crops. There's also disease transmission between wild and farmed species, so it can have an impact on wild species that we want to protect. And also escapes can regularly happen, and they can affect the aquatic environment, and also habitat loss in terms of where the farms are located. So I want to touch on a couple of research topics that we focused on at the center. This is a poster from World War I, and it reminds us of a very special characteristic of wild-caught seafood. When we catch seafood out either in a marine setting or a freshwater setting, we have not had to feed that animal. And so if we can manage those fisheries in a very sustainable way, and it's possible that if we changed our management of fisheries globally, we could let populations rebound and then harvest. The harvest would be even higher potentially on the global scale. But that's very difficult to do when people are trying to catch what they can and make a living. And so at the center, we've done some research on the implications of the feed needs for a growing aquaculture industry. And we've explored and highlighted, like I said, the limited resources that are available. There was a lot of excitement about incorporating crop-based feed ingredients into aquaculture feeds and using less fish meal and fish oil because it's from a limited source, mostly wild fish. And so we've done some work to point out that the terrestrial agricultural system is also limited, and when we convert either forests or places where we are growing food directly for human food and we turn it into animal feed, there is a loss of efficiency when we have to feed an animal and then feed ourselves. There's always a loss of efficiency, and so we need to take into account the appropriate level of the animal products in diets to provide the nutrients that we need, but not have a diet that has too much, and then our footprint, the environmental footprint of our diet is too large, and that's the case in the U.S. We also conducted some research looking into the issue where farmed aquatic species require feed that is very nutrient dense and specifically high in protein. And so fish and shrimp require feed inputs that have higher levels of protein compared to terrestrial animals that we eat. And so when we expand production of farmed seafood, we have to grow and create that protein first. And some of it can come from waste products, and there's lots of research and development going on to develop like insect-based feeds that have fed on feed waste or something. But as it is now, we do feed a lot of crop products, soy and the like. Another area of research is focused on studying the supply chains and doing life cycle analyses of the resources, mostly energy and water, that are inputted into the entire supply chain, and then also looking at waste levels, because seafood, as I hope is evident, is a very special type of food. A lot of it is from our oceans and from wild aquatic systems. Some of it is farmed. It's highly nutritious. In some areas, it's very important for global food security. And so we don't want it to go wasted. But seafood is also highly perishable. Some forms of seafood are very highly perishable. And so studying the supply chains and identifying strategies to reduce waste saves the resources that are inputted into that system, whether it's resources to grow the feed or to go out and catch fish, all the way down to when fish is brought home by a consumer or purchased in a restaurant. We want to reduce seafood waste as much as we can, because if we can reduce waste and increase the availability of seafood and consumption of seafood without actually producing more, that would be a win-win. So I have two slides on my informal diagnosis of the planetary health focused on seafood, and it is mixed. So I just want to touch on a few extra issues where there are emerging threats that are highly relevant to what I covered today, and I don't have time to go into all of them, but I wouldn't be providing thorough information if I didn't touch on some. So I'm going to start with the bad news first. So climate change and ocean acidification are massive emerging threats for aquaculture, but primarily fisheries. The ocean system on our planet has been acting as a buffer for the effects of climate change. The ocean has absorbed lots of heat and also lots of CO2. And so the environment in the ocean is changing. Aquatic animals are moving towards the poles, and it's hard to overstate, but this could be potentially very devastating, especially for low and middle income countries that are very dependent on certain food sources that could migrate somewhere else. Ocean acidification affects many of the animals, but especially shellfish that cannot build their shells when the acidity goes up. So this is a huge issue. There's also illegal, unreported, and unregulated fishing. This is a very difficult part of our food system to have great data on, because when you're out on your boat, some people are fishing where they're not following the rules. They are catching things illegally, and they can find a way to land it in a port and sell it. And so there are questions about the accuracy of the FAO data. And some research has indicated that the peak we see in the mid-1990s could have been actually higher if you do a better job including small-scale fisheries, and the research suggests that there is a more severe decline since the mid-1990s than the FAO data indicates, and that is highly problematic for obvious reasons. Also, in terms of contaminants, microplastics is an emerging issue. We don't really have a handle on that, but there are indications that it would create even more highly contaminated seafood, not just because the microplastics can get into their bodies, but because they absorb other contaminants in the aquatic environment and then enter the aquatic animals' bodies. So we have some emerging issues there. Also, algal blooms caused by excess nutrients, combined with climate change and combined with the way that we grow our food in the terrestrial settings, we're seeing more of these severe algal blooms where it's killing coastal populations of fish. And then lastly, on this slide, a lack of equity. So that's true in terms of access to healthy diets more broadly. But as I've said, seafood is a special type of food and can play a really important part in diets where there is a lack of diversity, because you can provide some micronutrients and some omega-3s, and you get a lot of bang for your buck when especially highly nutritious forms of seafood are available to populations that are facing food insecurity and malnutrition. So that lack of equity, especially with seafood, is problematic. So I do want to end on a hopeful note. The diagnosis is still mixed, but here are my hopeful thoughts. So there are efforts ongoing to expand effective fisheries management to low and middle income countries. We have evidence in high income countries to show that it is worth it to limit those catches and allow populations to rebound. It is not at all an easy effort, but it is something that is happening, and I'm hopeful that that we can spread that model. Also, addressing aquaculture regulatory gaps. Some places where aquaculture is expanding, the regulations are addressing, they haven't been created for aquaculture, and so we need to address those regulatory gaps, but I put it on the hopeful side because I think that it is doable, and the stakeholders working on aquaculture tend to be informed and concerned about sustainability issues, and so they are more open to evidence. I mentioned microplastics on the last slide, but I think it's hopeful that microplastics are gaining a lot of attention from the public, and so hopefully there will be more serious action taken to reduce the flow of pollutants into the aquatic environment. There's also opportunities and current efforts going on to support the least resource-intensive types of farmed and wild seafood, and that would allow us to provide more nutritious food with the lowest environmental footprint possible. And so there are really special types of seafood, like the filter feeders I mentioned, where we can expand access and expand production without causing a real expansion in the environmental footprint of that diet. And related to that, develop sustainable aquaculture that is accessible to vulnerable populations. So because aquatic species, they have the low FCRs, but they require dense feed. And I believe there's a relationship there to the cost. So if you have a farmed animal that requires less feed than other farmed animals, you would expect that protein to be more affordable. But if you go to the grocery store, there are some forms of farmed seafood that is more affordable, but salmon has a very low feed conversion ratio, but it's a pretty expensive form of animal protein. And one factor is their very dense feed that they require. They have very high protein and fat content in their feed, and so they can't get the cost down on that very important input. But there are many other species that we can focus on and expand, especially in low and middle income countries where we can get away from focusing on the development of the high value species that really is never going to help us feed vulnerable populations. And that is all I have. Thank you so much for your attention.
Thank you, Jillian. I suspect there are at least 20 questions about the food system. We're going to, though, in the interest of time, David, do you have a question? No, you didn't. Okay, because I would let you ask that question. Yeah. We're inviting Dr. John Groupman to give us his vision of, just your vision.
It's Sight and Life.
Yeah, it's Sight and Life.
So I'm going to do something I haven't done since 1997. I'm actually going to give a talk without PowerPoint. There you go. I have 35 millimeter slides to show you now. Okay. So Keith gave me the task to sort of reflect on some aspects of nutrition and looking towards 2030. Initially, we talked about looking over the next 100 years, but I think that technologies in our science is moving so rapidly that a 12 or 13-year perspective is probably appropriate. And also reflecting on this is that for the last 14 years, I've been collaborating with Keith on the omics technologies. And a lot of this really was stimulated by a Gates initiative that pulled together very diverse groups across the school to talk about how we could bring together the nutritional, in our case, the nutritional scientists, the basic biology community, and the technology community represented by proteomics. And this partnership has taken us on a 14-year journey, but is only now really being deployed in the development of biomarkers that we feel are exquisitely important in terms of doing the types of nutritional interventions that we think are critical. So when we look to 2030, I'm going to try and touch upon some of the technologies that I think are going to be very important over the next 10 years or so. The second point that I want to make is, to come full circle to some comments that Keith made, was that we are in the 50th anniversary of the interactions in nutrition and infection. And when you look at the key authors of that report, the key collaborators of the report, one was Nevin Scrimshaw, who was the chair of the department that I got my degree from, and really pioneered not only in nutrition, but also in the food toxicology world, the anti-nutritional compounds, if you will. Another one of the authors was John Everett Gordon, who was an epidemiologist from Harvard. And it turns out that John Gordon was the person who did the first aflatoxin liver cancer study in Thailand as part of the epidemiology of looking at a foodborne contaminant. And last individual was, of course, Carl Taylor, who was incredibly welcoming to me when I first came here 30 years ago. So those three authors, as we look in not only in the field of nutrition, but how their collaborative interactions really help forward a lot of our science. So let me first start by saying that I think it's very exciting that we're now really in the biology century. And if we look at what has happened, that at the start of this century, the first draft of the human genome, the culmination of 13 years worth of work that cost $3 billion to do in 2018 dollar equivalents.
So 13 years, $3 billion to get a draft genome. And now, for the cost of flying from Baltimore to London, economy on United Airlines, you can get your genome sequenced. So in the course of the 13 years that it took to do the first draft, in, if you will, the 15 years since, the technologies have been deployed that have dropped the cost of doing sequencing enormously. Some of that work is built upon a history at Hopkins that I think we might sometimes forget. One are the discoveries of Dan Nathans and Ham Smith in 1970 of restriction enzymes, which were the cornerstone biology that was necessary to do a lot of the genomic work that's been done. The second work that was not done here, but the pioneering work of PCR technology in the 1980s, the ability to actually make copies of DNA. Without that technology, we wouldn't be doing next generation sequencing. We would be still doing Maxim Gilbert gels that could sequence about 18 nucleotides. So these technologies have been deployed and deployed extraordinarily rapidly. So this cost of doing sequencing has dropped enormously. This is being deployed in clinical medicine all the time in terms of the development of targeted drugs that are really saving lives. The ability of somebody here at Hopkins being diagnosed with a tumor, sequencing to look at whether a mutation exists that makes for a druggable target. And in the case of non-small cell lung cancer and several other diseases, this has been extraordinary breakthroughs only in the last really 8 to 10 years or so. The capacity to do DNA sequencing on our planet is absolutely breathtaking. We now have the ability to do 80 petabytes, that's 80 times 10 to the 15th bytes of data from sequencing machines that exist on our planet right now. 80 petabytes may sound like a big number. It is a big number. If any of you have Netflix, that's 30 times the amount of data that's stored in all the movies on Netflix. So our ability to do DNA sequencing is extraordinarily breathtaking. Our ability to utilize those data is extraordinarily, shall we say, we utilize so little of the data that we sequence that the missed opportunities in terms of the integration, particularly in nutrition, I think it's a challenge for our bioinformaticians collaborating in the nutritional sciences areas. So the technologies that we have been transformative in DNA. This is now being translated in terms of small molecule analysis in areas such as metabolomics. Our throughput in terms of mass spectrometry is increasing very rapidly. Our ability to actually make exquisitely sensitive measurements is increasing. Our ability to utilize those data and integrate it into the health spectrum is woefully behind the curve. A lot of the model systems we use are really ancient model systems that are not being deployed in terms of a variety of health endpoints. And I'd like to say that our ability to actually accomplish building better integrative strategies is actually impeded by the way we have to write our grants to the NIH and other funding agencies, which reward reduction of science and ignore a lot of the ability of integrating data together. On the positive side, it is absolutely breathtaking, our ability to use liquid biopsy strategies, not only for cancer diagnosis and other disease diagnoses, but it's also being deployed in terms of fetal diagnosis. The ability to actually isolate fetal cells from maternal circulation and do measurements is really transformative. So right now in our lab, we can take 100 microliters of blood and actually measure a variety of mutations in various tumor suppressor genes that are predictive of development of cancer several years in the future. So this type of strategy, the analytical strategies, again, are strategies that we couldn't have conceived of 50 years ago when those first reports came out about nutrition and infection. The other area that I think is an area that we can actually pioneer and be leaders in is the area of convergent science. Now, this is an area that Phil Sharp at MIT has really been pushing in terms of convergence, or the bringing together of the biological, the engineering, the physical, the social, and behavioral sciences together to address important complex problems, which after all are the cornerstone of public health. And in particular, in the area of public health nutrition, the convergent sciences, and there is a National Academy report that was released 2 months ago on the challenges in this area, that public health nutrition can actually be the nexus for how we would deploy convergent science in order to address these emergent challenges in health. This school is extraordinarily positioned to be a leader in that area, and indeed this university is actually well positioned to accomplish each one of those strategies that are put forward in that challenge. So over the course of today, we've heard about an enormous number of successes over the last 100 years. Again, I'm a firm believer that the deployment of a number of the technologies that we have and the use and analysis of that data could truly be emergent. And as we take systems approaches to these types of problems, I think we can accomplish perhaps more in the next 10 years than maybe what we've been able to do over the last 100. So let me close with two thoughts. And the first thought is that 100 years ago, as we heard, people were dying from deficiencies of a variety of nutrients. We've overcome through a lot of the science and knowing, at least to the first approximation, how to deploy strategies to prevent that. But I'd like to submit that the human substrate is really dramatically different now and will be continuing to differentiate itself over the next 10 to 20 years. Certainly in my lifetime, there weren't 25 million cancer survivors as there are today. For many individuals, cancer was a death sentence. The fact that we have cancer survivors who have hypertension and perhaps type 2 diabetes and are being treated for other chronic disease issues means that the complexity of the human substrate is so much different now that our ability to know how appropriate nutrition, how appropriate diets are for individuals who have multiple chronic diseases is a challenge that has never been faced before in our studies. It certainly wasn't challenged by Evie McCollum's work in this particular model system. And indeed, the fact that we have people with all of these multiple chronic diseases who are really crying out for what are the best diets, what are the best nutritional strategies in order to have the greatest opportunity for life extension as our clinical medicine improves. So again, I think we've had an acceleration of our knowledge base in biology that, again, is breathtaking. We don't use textbooks anymore because they're out of date even before you actually submit your chapters. And now I think one of the areas that I think is not just a challenge but is a reality is that our reductionist science teaches us a lot about what happens not only at the cellular level but at the subcellular level to an extraordinary degree. Our recognition is that it's at this macro systems level of an organism that nutrition really plays a critically important role in. And if we can provide leadership in order to not only do better studies in human populations, but inform the basic science community from our human investigations as to what science needs to be done within these model systems, I think we can make an extraordinary amount of progress as we've had over the course of human nutrition in the school. So that's my closing remark. I did not use a single PowerPoint slide, but I did write it out in PowerPoint on my computer. Thanks.
Didn't you just get off a plane from China?
No, Seattle.
Oh, Seattle, okay. I was going to say, we should send you to China more often to come back.
That's next
and
week.
share those thoughts.
It is next week.
Thank
Yeah,
you.
okay.
Those were great. This brings to conclusion, except for just a few comments, this symposium. I want to thank sponsors. I want to thank the speakers for investing in this afternoon and for being here. I'd like to thank everybody here who has stayed. I would like to thank a couple of people in particular who have worked very hard to make today happen. Rhonda Skinner, I don't know if she's here. She's probably making things happen elsewhere right now. Angela Casey, Audrey Buckland, Carrie Schulze, Shannon King, and her cadre of other students who rallied around to be hosts and hostesses who are still working on that. Brandon Howard, Lauren Haney Provost, Heath Elliott, and Barb Verrier have all been just tremendously helpful in making today happen. We have another part of our program beginning in about 20 minutes in Somer Hall, a spectacular wrap-up for the day by Peter Menzel and Faith DeLuzio, just an enormously talented photographic and essay journalist team whose iconic photographs we've all seen over the years, and they put it to story. So it's a tremendous opportunity. And then the questions that you didn't ask, I asked that you ask during our reception in Finestone, so you can eat and drink and nail any of those speakers you want in terms of questions and get them, corner them and get some answers. And I'm hoping that today is inspirational for us in terms of generating interest and inspiring our own work. And in that regard, it's a pleasure to say that we have an anonymous donation of $50,000 for the Centennial event for scholarships in human nutrition and international health. Scholarships that have been mentioned are related to the George Graham Endowment, to Nancy Stevens, to the Cruz Family Award. And so it's a reminder to us all to think about donating to our school and donating to programs that exist within your own departments, whether our departments or whether it's international health, program in human nutrition, environmental health and engineering, whatever the department is, there are existing mechanisms and tools that are there for supporting our students. And this particular anonymous donation is going toward those existing instruments that are in place to help support students. And so, we're not all Michael Bloombergs, but we do have loose change in pockets. And so it's an opportunity as we look to our next century and those who celebrate the next 200 years from now that they can see that we have all done our job in terms of supporting student scholarships and the advancement of science and the excitement to pursue the excitement that was demonstrated today and that will continue. So I thank you, and I ask you to move upstairs to the Somer Hall, get your ticket as you walk in, and that will allow you to receive a free $40 value photograph book that is spectacular that Peter and Faith have written in the past. So please go on up there and get a seat. We have reserved the first 3 rows of Somer Hall just in case the wild notion that the place is full. Those of you here have first dibs on the first 3 rows. So thank you very much.